1. What is the priority nursing action for a patient with sickle cell anemia experiencing a vaso-occlusive crisis? A. Administer oxygen therapy. B. Encourage ambulation. C. Administer pain medication. D. Restrict fluid intake. Answer: C. Administer pain medication. Rationale: in a vaso-occlusive crisis, sickle-shaped red blood cells obstruct blood flow, causing severe pain. The priority is to manage pain to improve patient comfort and prevent further complications. Administering pain medication, C, addresses this urgent need. Oxygen therapy, A, is appropriate if hypoxia is present, but pain is the primary concern. Encouraging ambulation, B, may worsen pain and is contraindicated during a crisis. Restricting fluids, D, is incorrect as hydration is essential to reduce blood viscosity and promote circulation. 2. A patient with leukemia has a white blood cell count of 2,000/mm superscript 3. What is the most important nursing intervention? A. Encourage a high-protein diet. B. Implement infection control measures. C. Administer iron supplements. D. Promote frequent ambulation. Answer: B. Implement infection control measures. Rationale: a white blood cell count of 2,000/mm superscript 3 indicates leukopenia, increasing the risk of infection in a patient with leukemia. Implementing infection control measures, B, such as hand hygiene and protective isolation, is critical to patient safety. A high-protein diet, A, may support overall health, but is not the priority. Iron supplements, C, are irrelevant to leukopenia and may be contraindicated. Frequent ambulation, D, does not address the immediate risk of infection. 3. A nurse is caring for a patient receiving a blood transfusion. Which symptom indicates a possible transfusion reaction? A. Increased energy levels. B. Fever and chills. C. Improved skin color. D. Decreased heart rate. Answer: B. Fever and chills. Rationale: fever and chills, B, are classic signs of a transfusion reaction, such as a febrile non-hemolytic reaction, and require immediate intervention, including stopping the transfusion. Increased energy levels, A, and improved skin color, C, suggest a positive response to the transfusion, not a reaction. A decreased heart rate, D, is not typically associated with a transfusion reaction, which often causes tachycardia. 4. A patient with hemophilia A is admitted with joint swelling. What is the nurse's first action? A. Apply a warm compress to the joint. B. Administer factor VIII replacement. C. Encourage active range of motion. D. Administer oral analgesics. Answer: B. Administer factor VIII replacement. Rationale: hemophilia A is characterized by deficient factor VIII, leading to bleeding into joints, causing swelling and pain. The first action is to administer factor VIII replacement, B, to stop bleeding and prevent further damage. Warm compresses, A, are contraindicated as heat may increase bleeding. Active range of motion, C, could worsen bleeding and is avoided during acute episodes. Oral analgesics, D, may help with pain but do not address the underlying bleeding. 5. A nurse is educating a patient with iron deficiency anemia. Which food should the nurse recommend to increase iron intake? A. White bread. B. Spinach. C. Bananas. D. Milk. Answer: B. Spinach. Rationale: spinach, B, is a rich source of iron, particularly non-heme iron, which is beneficial for patients with iron deficiency anemia. White bread, A, has low iron content and is not a good source. Bananas, C, are high in potassium but not iron. Milk, D, is a poor source of iron and may inhibit iron absorption if consumed in excess. The nurse should also educate the patient on consuming vitamin C-rich foods to enhance iron absorption. 6. A patient with thrombocytopenia has a platelet count of 40,000/mm superscript 3. What is the nurse's priority action? A. Administer platelet transfusion. B. Encourage vigorous toothbrushing. C. Apply heat to bruised areas. D. Allow the patient to ambulate freely. Answer. A. Administer platelet transfusion. Rationale. A platelet count of 40,000/mm superscript 3 indicates severe thrombocytopenia, increasing the risk of bleeding. The priority is to administer a platelet transfusion, A. To restore platelet levels and prevent hemorrhage. Vigorous toothbrushing, B. Can cause gum bleeding and is contraindicated. Applying heat, C. May worsen bruising or bleeding. Unrestricted ambulation, D. Increases the risk of injury and bleeding, so safety precautions are needed. 7. A nurse is monitoring a patient receiving heparin therapy. Which laboratory value should the nurse prioritize? A. Hemoglobin. B. Activated partial thromboplastin time, APTT. C. White blood cell count. D. Serum potassium. Answer. B. Activated partial thromboplastin time, APTT. Rationale. Heparin is an anticoagulant, and its therapeutic effect is monitored by the APTT-B, which assesses clotting time to ensure safe dosing. Hemoglobin, A. Monitors for anemia or bleeding but is not specific to heparin. White blood cell count, C. Is unrelated to heparin monitoring. Serum potassium, D. Is not directly affected by heparin therapy. 8. A patient with pernicious anemia is prescribed vitamin B12. What is the most effective administration route? A. Oral tablets. B. Intravenous infusion. C. Intramuscular injection. D. Sublingual drops. Answer. C. Intramuscular injection. Rationale. Pernicious anemia results from an inability to absorb vitamin B12 due to intrinsic factor deficiency. Intramuscular injection, C. Bypasses the gastrointestinal tract, ensuring effective delivery. Oral tablets, A, and sublingual drops, D, are ineffective due to poor absorption. Intravenous infusion, B, is not a standard route for vitamin B12 administration. 9. A patient with chronic lymphocytic leukemia reports fatigue and night sweats. What is the nurse's best response? A. Encourage increased physical activity. B. Assess for signs of infection. C. Recommend a low-iron diet. D. Suggest warm baths before bedtime. Answer. B. Assess for signs of infection. Rationale. Fatigue and night sweats in chronic lymphocytic leukemia may indicate infection, a common complication due to impaired immunity. Assessing for infection, B, is the priority to ensure timely intervention. Increased physical activity, A, may exacerbate fatigue. A low-iron diet, C, is irrelevant to leukemia. Warm baths, D, may provide comfort but do not address the underlying issue. 10. A nurse is caring for a patient with a hemoglobin level of 7G/DL. Which intervention is most appropriate? A. Encourage a high-fiber diet. B. Prepare for blood transfusion. C. Administer oral antibiotics. D. Promote deep breathing exercises. Answer. B. Prepare for blood transfusion. Rationale. A hemoglobin level of 7G/DL indicates severe anemia, requiring a blood transfusion, B, to restore oxygen carrying capacity. A high-fiber diet, A, is unrelated to anemia treatment. Antibiotics, C, are not indicated unless infection is present. Deep breathing exercises, D, may help with oxygenation but do not correct the underlying anemia. 11. A patient with sickle cell disease is admitted with chest pain and dyspnea. What conditions should the nurse suspect? A. Acute chest syndrome. B. Pulmonary edema. C. Myocardial infarction. D. Pneumothorax. Answer. A. Acute chest syndrome. Rationale. Acute chest syndrome, A, is a life-threatening complication of sickle cell disease characterized by chest pain and dyspnea due to vaso-occlusion in the lungs. Pulmonary edema, B, is less likely without heart failure signs. Myocardial infarction, C, is possible but less common in sickle cell patients. Pneumothorax, D, is unrelated to sickle cell pathophysiology. 12. A nurse is teaching a patient with hemophilia about injury prevention. Which instruction is most important? A. Avoid contact sports. B. Increase calcium intake. C. Use a soft toothbrush. D. Wear loose clothing. Answer: A. Avoid contact sports. Rationale: hemophilia increases bleeding risk, so avoiding contact sports, A, is critical to prevent trauma-induced hemorrhages. Increasing calcium, B, is unrelated to bleeding prevention. A soft toothbrush, C, is helpful but less critical than avoiding trauma. Loose clothing, D, does not directly prevent injury. 13. A patient receiving warfarin has an INR of 5.2. What is the nurse's first action? A. Administer vitamin K. B. Increase the warfarin dose. C. Encourage green leafy vegetables. D. Continue current therapy. Answer: A. Administer vitamin K. Rationale: an INR of 5.2 indicates excessive anticoagulation, increasing bleeding risk. Administering vitamin K, A, reverses warfarin's effect. Increasing the dose, B, worsens the risk. Green leafy vegetables, C, contain vitamin K and may reduce warfarin's effect, but are not an immediate solution. Continuing therapy, D, is unsafe without correction. 14. A patient with iron deficiency anemia reports taking iron supplements with milk. What should the nurse advise? A. Continue taking with milk. B. Take with orange juice. C. Take with a high-fiber meal. D. Take before bedtime. Answer: B. Take with orange juice. Rationale: iron absorption is enhanced by vitamin C, found in orange juice. B. Milk, A, contains calcium, which inhibits iron absorption. High-fiber meals, C, may reduce absorption. Taking iron before bedtime, D, is not optimal for absorption and may cause gastrointestinal upset. 15. A nurse is assessing a patient with disseminated intravascular coagulation, DIC. Which finding is most concerning? A. Prolonged bleeding from venipuncture sites. B. Blood pressure of 120/80 mmHg. C. Heart rate of 80 bpm. D. Respiratory rate of 16 breaths/min. Answer: A. Prolonged bleeding from venipuncture sites. Rationale: DIC causes abnormal clotting and bleeding, making prolonged bleeding from venipuncture sites, A, a critical sign requiring immediate intervention. Blood pressure, B, heart rate, C, and respiratory rate, D, are normal and not indicative of DIC complications. 16. A patient with polycythemia vera is at risk for which complication? A. Thrombosis. B. Osteoporosis. C. Hypoglycemia. D. Renal failure. Answer: A. Thrombosis. Rationale: polycythemia vera causes increased red blood cell production, leading to hyperviscosity and a high risk of thrombosis. A. Osteoporosis, B, hypoglycemia, C, and renal failure, D, are not directly associated with this condition. 17. A nurse is preparing a patient for a bone marrow biopsy. What is the priority nursing action? A. Administer a sedative. B. Obtain informed consent. C. Encourage fluid intake. D. Apply a warm compress. Answer: B. Obtain informed consent. Rationale: a bone marrow biopsy is an invasive procedure, so obtaining informed consent, B, is the priority to ensure the patient understands the risks and benefits. Administering a sedative, A, may follow, but is not the first step. Fluid intake, C, and warm compresses, D, are not relevant to the procedure. 18. A patient with aplastic anemia is at risk for which condition? A. Infection. B. Hypertension. C. Hyperglycemia. D. Joint pain. Answer: A. Infection. Rationale: aplastic anemia causes decreased production of all blood cells, including white blood cells, increasing infection risk. A. Hypertension, B, hyperglycemia, C, and joint pain, D, are not directly related to aplastic anemia. 19. A nurse is caring for a patient with a history of deep vein thrombosis, DVT. Which instruction is most important? A. Avoid prolonged sitting. B. Increase sodium intake. C. Perform vigorous exercise. D. Wear loose stockings. Answer: A. Avoid prolonged sitting. Rationale: Prolonged sitting increases venous stasis, a risk factor for DVT recurrence, so avoiding it, A, is critical. Increasing sodium, B, is unrelated and may cause fluid retention. Vigorous exercise, C, may dislodge a clot. Loose stockings, D, do not provide the compression needed to prevent DVT. 20. A patient with multiple myeloma reports bone pain. What is the nurse's best action? A, encourage weight-bearing exercises. B, administer prescribed analgesics. C, apply ice to affected areas. D, restrict calcium supplements. Answer: B, administer prescribed analgesics. Rationale: multiple myeloma causes bone pain due to lytic lesions, so administering prescribed analgesics, B, is the best action to manage pain. Weight-bearing exercises, A, may increase fracture risk. Ice, C, is less effective for bone pain. Calcium supplements, D, may be needed due to hypercalcemia risks in multiple myeloma. 21. A nurse is reviewing a patient's complete blood count, CBC. Which finding indicates anemia? A, hemoglobin 10G/DL. B, white blood cell count 8,000/mm superscript 3. C, platelet count 200,000/mm superscript 3. D, hematocrit 45%. Answer: A, hemoglobin 10G/DL. Rationale: hemoglobin 10G/DL, A, is below the normal range, 12 to 16 G/DL for females, 14 to 18 G/DL for males, indicating anemia. White blood cell count, B, platelet count, C, and hematocrit, D, are within normal ranges and do not indicate anemia. 22. A patient with Hodgkin lymphoma reports enlarged lymph nodes. What should the nurse assess next? A, presence of fever and weight loss. B, blood glucose levels. C, joint mobility. D, skin turgor. Answer: A, presence of fever and weight loss. Rationale: enlarged lymph nodes in Hodgkin lymphoma may be accompanied by B symptoms, fever, weight loss, night sweats, so assessing for these, A, is critical. Blood glucose, B, joint mobility, C, and skin turgor, D, are not directly related to lymphoma assessment. 23. A nurse is administering packed red blood cells. How long should the transfusion take? A, 30 minutes. B, 1 hour. C, 2 to 4 hours. D, 6 hours. Answer: C, 2 to 4 hours. Rationale: packed red blood cells should be transfused over 2 to 4 hours, C, to prevent fluid overload and ensure safety. 30 minutes, A, or 1 hour, B, is too fast, risking complications. 6 hours, D, is too long, increasing the risk of bacterial contamination. 24. A patient with folate deficiency anemia is prescribed folic acid. What should the nurse monitor? A, blood pressure. B, serum folate levels. C, respiratory rate. D, urine output. Answer: B, serum folate levels. Rationale: folic acid therapy aims to correct folate deficiency, so monitoring serum folate levels, B, assesses treatment effectiveness. Blood pressure, A, respiratory rate, C, and urine output, D, are not directly affected by folate therapy. 25. A patient with a history of pulmonary embolism is prescribed enoxaparin. What should the nurse teach the patient? A, inject into the thigh. B, monitor for signs of bleeding. C, take with meals. D, avoid vitamin K supplements. Answer: B, monitor for signs of bleeding. Rationale: enoxaparin is a low molecular weight heparin, and bleeding is a major risk, so monitoring for signs of bleeding, B, is critical. Enoxaparin is injected into the abdomen, not the thigh, A. It is not taken orally, C. Vitamin K, D, affects warfarin, not enoxaparin. 26. A nurse is caring for a patient with sickle cell anemia. Which intervention promotes hydration? A, limit fluid intake to 1 L/day. B, encourage oral fluid intake. C, administer diuretics. D, restrict sodium intake. Answer: B, encourage oral fluid intake. Rationale: hydration reduces blood viscosity in sickle cell anemia, preventing vaso-occlusion, so encouraging oral fluid intake, B, is appropriate. Limiting fluids, A, is contraindicated. Diuretics, C, cause dehydration. Sodium restriction, D, is not directly related to hydration in this context. 27. A patient with thalassemia major requires frequent blood transfusions. What complications should the nurse monitor? A, iron overload. B, hypokalemia. C, hyperglycemia. D, osteoarthritis. Answer: A, iron overload. Rationale: frequent transfusions in thalassemia major lead to iron overload, A, causing organ damage. Hypokalemia, B, hyperglycemia, C, and osteoarthritis, D, are not directly related to transfusion complications. 28. A nurse is assessing a patient with a suspected bleeding disorder. Which finding supports this diagnosis? A, petechiae on the skin. B, blood pressure 130/85 mmHg. C, respiratory rate 18 breaths/min D, temperature 98.6 degrees Fahrenheit. Answer: A, petechiae on the skin. Rationale: petechiae A are small, pinpoint hemorrhages indicating a bleeding disorder, such as thrombocytopenia. Blood pressure, B, respiratory rate, C, and temperature, D, are normal and not specific to bleeding disorders. 29. A patient with chronic myeloid leukemia is prescribed imatinib. What should the nurse teach the patient? A, take on an empty stomach. B, avoid sun exposure. C, limit fluid intake. D, increase dietary fiber. Answer: A, take on an empty stomach. Rationale: imatinib is most effective when taken on an empty stomach. A, to ensure optimal absorption. Sun exposure, B, is not a specific concern with imatinib. Fluid intake, C, should not be limited. Dietary fiber, D, is unrelated to imatinib administration. 30. A nurse is caring for a patient with a prothrombin time, PT, of 20 seconds. What does this indicate? A, normal coagulation. B, increased bleeding risk. C, infection. D, anemia. Answer: B, increased bleeding risk. Rationale: a PT of 20 seconds is prolonged. Normal is 11 to 13.5 seconds, indicating increased bleeding risk. B, due to impaired clotting. It does not indicate normal coagulation. A, infection. C, or anemia. D. 31. A patient with anemia reports shortness of breath during activity. What is the nurse's best action? A, administer supplemental oxygen. B, encourage vigorous exercise. C, restrict fluid intake. D, apply a warm compress. Answer: A, administer supplemental oxygen. Rationale: shortness of breath in anemia results from reduced oxygen carrying capacity, so administering supplemental oxygen, A, is appropriate. Vigorous exercise, B, may worsen symptoms. Fluid restriction, C, is not indicated. A warm compress, D, is irrelevant to the symptom. 32. A nurse is preparing a patient for a splenectomy due to hemolytic anemia. What is the priority preoperative teaching? A, importance of early ambulation. B, risk of infection post-surgery. C, need for a low-iron diet. D, avoidance of deep breathing. Answer: B, risk of infection post-surgery. Rationale: splenectomy increases infection risk due to the spleen's role in immunity, so teaching about infection prevention, B, is critical. Early ambulation, A, is important but secondary. A low-iron diet, C, is not relevant. Deep breathing, D, should be encouraged to prevent respiratory complications. 33. A patient with a history of heparin-induced thrombocytopenia, HIT, requires anticoagulation. Which medication is safest? A, heparin. B, warfarin. C, argatroban. D, enoxaparin. Answer: C, argatroban. Rationale: HIT is a serious complication of heparin, so heparin, A, and enoxaparin, D, are contraindicated. Argatroban, C, a direct thrombin inhibitor, is safe for HIT patients. Warfarin B is not ideal initially due to delayed onset and risk of thrombosis in HIT. 34. A nurse is caring for a patient with a hematocrit of 25%. What is the priority intervention? A. Encourage a high-protein diet. B. Prepare for blood transfusion. C. Administer oral analgesics. D. Promote bed rest. Answer. B. Prepare for blood transfusion. Rationale: a hematocrit of 25% indicates severe anemia requiring a blood transfusion. B. To correct oxygen carrying capacity. A high-protein diet, A, supports recovery but is not immediate. Analgesics, C, are not indicated. Bed rest, D, may prevent exertion but does not address the anemia. 35. A patient with lymphoma is receiving chemotherapy. What should the nurse monitor for as a common side effect? A. Neutropenia. B. Hyperkalemia. C. Hypocalcemia. D. Joint stiffness. Answer. A. Neutropenia. Rationale: chemotherapy often causes neutropenia. A. Increasing infection risk due to reduced white blood cells. Hyperkalemia. B. Hypocalcemia. C. And joint stiffness. D. Are less common side effects of chemotherapy for lymphoma. 36. A patient with sickle cell anemia is experiencing fatigue and pallor. What is the nurse's priority action? A. Administer pain medication. B. Assess oxygen saturation. C. Encourage high-calorie snacks. D. Restrict physical activity. Answer. B. Assess oxygen saturation. Rationale: fatigue and pallor in sickle cell anemia suggest reduced oxygen carrying capacity due to anemia or vaso-occlusion. Assessing oxygen saturation, B, is the priority to determine if hypoxia is present. Pain medication, A, is indicated for pain, not fatigue. High-calorie snacks, C, support nutrition but are not immediate. Restricting activity, D, may be appropriate but does not address the underlying issue. 37. A nurse is monitoring a patient with a history of von Willebrand disease. Which symptom indicates a bleeding episode? A. Epistaxis. B. Hypertension. C. Fever. D. Weight gain. Answer. A. Epistaxis. Rationale: von Willebrand disease impairs clotting, making epistaxis, nosebleeds, A common sign of a bleeding episode. Hypertension, B, fever, C, and weight gain, D, are not directly related to bleeding in this condition. 38. A patient with acute myeloid leukemia is prescribed chemotherapy. What is the nurse's priority teaching? A. Maintain a low-sodium diet. B. Monitor for signs of infection. C. Increase calcium intake. D. Avoid deep breathing exercises. Answer. B. Monitor for signs of infection. Rationale: chemotherapy suppresses bone marrow, causing neutropenia and increasing infection risk. Teaching the patient to monitor for infection signs, B, is critical. Low-sodium diet, A, and calcium intake, C, are unrelated to chemotherapy. Deep breathing, D, should be encouraged to prevent respiratory complications. 39. A nurse is caring for a patient receiving a platelet transfusion. Which action ensures safety? A. Infuse over 4 hours. B. Check vital signs before and during transfusion. C. Use a standard 4 catheter. D. Administer without a filter. Answer. B. Check vital signs before and during transfusion. Rationale: monitoring vital signs before and during a platelet transfusion, B, detects early signs of a transfusion reaction, ensuring safety. Platelets are infused over 15 to 30 minutes, not 4 hours. A microaggregate filter is needed, not a standard catheter, C, or no filter, D. 40. A patient with iron deficiency anemia reports constipation from iron supplements. What should the nurse suggest? A. Stop taking the iron. B. Increase dietary fiber. C. Take with milk. D. Reduce fluid intake. Answer. B. Increase dietary fiber. Rationale: constipation is a common side effect of iron supplements. Increasing dietary fiber, B, helps alleviate this. Stopping iron, A. Is not advisable without physician consultation. Taking with milk. C. Reduces iron absorption. Reducing fluid intake. D. Worsens constipation. 41. A patient with hemophilia B is prescribed factor IX. What is the nurse's priority assessment? A. Blood glucose levels. B. Signs of allergic reaction. C. Respiratory rate. D. Skin turgor. Answer. B. Signs of allergic reaction. Rationale. Factor IX is a blood product and allergic reactions are a potential risk during administration. Monitoring for signs of allergic reaction, B, is the priority. Blood glucose, A, respiratory rate, C, and skin turgor, D, are not directly related to factor IX administration. 42. A nurse is caring for a patient with a hematocrit of 20%. Which symptom is most concerning? A. Tachycardia. B. Mild headache. C. Increased appetite. D. Dry skin. Answer. A. Tachycardia. Rationale. A hematocrit of 20% indicates severe anemia, causing tachycardia. A. As the heart compensates for reduced oxygen delivery. This is concerning and requires intervention. Mild headache. B. Increased appetite. C. And dry skin. D. Are less urgent and not specific to anemia. 43. A patient with thrombocytopenia is scheduled for surgery. What should the nurse ensure? A. Platelet transfusion is available. B. High-protein diet is provided. C. Warm compresses are applied. D. Ambulation is encouraged. Answer. A. Platelet transfusion is available. Rationale. Thrombocytopenia increases bleeding risk during surgery, so ensuring platelet transfusion availability, A, is critical. A high-protein diet, B, is not specific to bleeding risk. Warm compresses, C, may worsen bleeding. Ambulation, D, does not address the surgical risk. 44. A nurse is reviewing a patient's lab results showing an APTT of 60 seconds. What medication is likely causing this? A. Aspirin. B. Heparin. C. Warfarin. D. Clopidogrel. Answer. B. Heparin. Rationale. A prolonged APTT, 60 seconds, indicates anticoagulation, most commonly caused by heparin B, which is monitored by APTT. Aspirin A and clopidogrel D affect platelets, not APTT. Warfarin C prolongs PT/INR, not APTT. 45. A patient with sickle cell disease reports joint pain. What is the nurse's first action? A. Apply ice to the joints. B. Administer prescribed analgesics. C. Encourage active range of motion. D. Restrict fluid intake. Answer. B. Administer prescribed analgesics. Rationale. Joint pain in sickle cell disease is often due to vaso-occlusion, requiring analgesics, B, as the first action to manage pain. Ice, A, may help but is secondary. Active range of motion, C, may worsen pain. Fluid restriction, D, is contraindicated as hydration is essential. 46. A patient with multiple myeloma is at risk for which electrolyte imbalance? A. Hypercalcemia. B. Hypokalemia. C. Hyponatremia. D. Hypomagnesemia. Answer. A. Hypercalcemia. Rationale. Multiple myeloma causes bone destruction, releasing calcium into the blood, leading to hypercalcemia, A. Hypokalemia, B. Hyponatremia, C. And hypomagnesemia, D. are not typically associated with this condition. 47. A nurse is caring for a patient with a history of pulmonary embolism. Which intervention prevents recurrence? A. Encourage prolonged bed rest. B. Administer anticoagulants as prescribed. C. Restrict dietary vitamin K. D. Apply warm compresses to legs. Answer. B. Administer anticoagulants as prescribed. Rationale. Anticoagulants, B. Prevent clot formation, reducing the risk of pulmonary embolism recurrence. Prolonged bed rest, A. Increases stasis and clot risk. Vitamin K restriction, C. Applies to warfarin, not all anticoagulants. Warm compresses, D. May increase circulation but are not preventive. 48. A patient with anemia is prescribed epoetin alpha. What should the nurse monitor? A. Blood pressure. B. Blood glucose. C. Respiratory rate. D. Urine output. Answer: A. Blood pressure. Rationale: epoetin alpha stimulates red blood cell production, potentially causing hypertension. Monitoring blood pressure, A, is critical. Blood glucose, B, respiratory rate, C, and urine output, D, are not directly affected by epoetin alpha. 49. A nurse is assessing a patient with suspected disseminated intravascular coagulation, DIC. Which lab result supports this diagnosis? A. Decreased fibrinogen. B. Increased hemoglobin. C. Normal platelet count. D. Decreased INR. Answer: A. Decreased fibrinogen. Rationale: DIC consumes clotting factors, leading to decreased fibrinogen, A, a hallmark of the condition. Increased hemoglobin, B, is not typical. Platelet count, C, is usually low in DIC. INR, D, is prolonged, not decreased in DIC. 50. A patient with chronic lymphocytic leukemia reports a fever. What is the nurse's first action? A. Administer antipyretics. B. Assess for infection. C. Encourage fluid restriction. D. Apply a cooling blanket. Answer: B. Assess for infection. Rationale: fever in chronic lymphocytic leukemia suggests infection due to impaired immunity. Assessing for infection, B, is the first action to identify the cause. Antipyretics, A, and cooling blankets, D, treat symptoms, but not the cause. Fluid restriction, C, is inappropriate as hydration is needed. 51. A patient with iron deficiency anemia is prescribed ferrous sulfate. When should the nurse advise taking it? A. With meals. B. At bedtime. C. With orange juice. D. With milk. Answer: C. With orange juice. Rationale: ferrous sulfate is best absorbed with vitamin C, such as in orange juice C. Taking with meals, A, or milk, D, reduces absorption due to food or calcium interference. Bedtime, B, is not optimal for absorption. 52. A nurse is caring for a patient with a prothrombin time, PT, of 18 seconds. Which medication is the patient likely taking? A. Heparin. B. Warfarin. C. Aspirin. D. Clopidogrel. Answer: B. Warfarin. Rationale: a prolonged PT, 18 seconds, indicates anticoagulation, typically caused by warfarin, B, which is monitored by PT/INR. Heparin, A, affects APTT. Aspirin, C, and clopidogrel, D, affect platelets, not PT. 53. A patient with hemophilia A falls and reports knee pain. What is the nurse's priority action? A. Apply a warm compress. B. Administer factor VIII. C. Encourage ambulation. D. Restrict ice application. Answer: B. Administer factor VIII. Rationale: knee pain after fall in hemophilia A suggests joint bleeding, requiring factor VIII, B, to stop bleeding. Warm compresses, A, worsen bleeding. Ambulation, C, may increase bleeding. Ice, D, is helpful but secondary to factor replacement. 54. A nurse is teaching a patient with sickle cell disease about self-care. Which instruction is most important? A. Avoid high altitudes. B. Increase dietary sodium. C. Limit physical activity to 1 hour daily. D. Use heating pads for pain. Answer: A. Avoid high altitudes. Rationale: high altitudes reduce oxygen availability, triggering sickle cell crises, so avoiding them, A, is critical. Sodium intake, B, is not directly related. Physical activity, C, should be balanced, not strictly limited. Heating pads, D, are contraindicated as they may worsen vaso-occlusion. 55. A patient with lymphoma reports night sweats and weight loss. What should the nurse document these as? A. Allergic reactions. B. Symptoms. C. Infection signs. D. Metabolic imbalances. Answer: B. Symptoms. Rationale: Night sweats and weight loss in lymphoma are B symptoms, B, indicating systemic disease and guiding treatment. They are not allergic reactions, A, infection signs, C, or metabolic imbalances, D. 56. A nurse is administering fresh frozen plasma. What is the primary purpose of this transfusion? A, increase red blood cell count. B, replace clotting factors. C, boost platelet production. D, enhance immune response. Answer: B, replace clotting factors. Rationale: fresh frozen plasma contains clotting factors and is used to replace them. B, in conditions like coagulopathy. It does not increase red blood cells. A, boost platelets. C, or enhance immunity. D. 57. A patient with thalassemia major reports fatigue. What should the nurse assess first? A, hemoglobin level. B, blood glucose. C, respiratory rate. D, skin integrity. Answer: A, hemoglobin level. Rationale: fatigue in thalassemia major is likely due to anemia, so assessing hemoglobin level, A, is the first step. Blood glucose, B, respiratory rate, C, and skin integrity, D, are not directly related to fatigue in this condition. 58. A nurse is caring for a patient with a platelet count of 20,000/mm superscript 3. Which precaution is most important? A, encourage vigorous oral hygiene. B, use an electric razor for shaving. C, allow unrestricted ambulation. D, apply heat to bruised areas. Answer: B, use an electric razor for shaving. Rationale: a platelet count of 20,000/mm superscript 3 indicates severe thrombocytopenia, increasing bleeding risk. Using an electric razor, B, prevents cuts and bleeding. Vigorous oral hygiene, A, may cause gum bleeding. Unrestricted ambulation, C, risks injury. Heat, D, worsens bruising. 59. A patient with pernicious anemia reports numbness in the extremities. What is the nurse's best action? A, administer vitamin B12. B, encourage ambulation. C, apply warm compresses. D, restrict dietary folate. Answer: A, administer vitamin B12. Rationale: numbness in pernicious anemia results from vitamin B12 deficiency affecting nerve function. Administering vitamin B12, A, addresses the cause. Ambulation, B, does not treat neuropathy. Warm compresses, C, are ineffective. Folate restriction, D, is unnecessary and may worsen anemia. 60. A nurse is monitoring a patient receiving warfarin. Which dietary instruction is most important? A, maintain consistent vitamin K intake. B, avoid all carbohydrates. C, increase calcium-rich foods. D, limit protein intake. Answer: A, maintain consistent vitamin K intake. Rationale: warfarin's anticoagulant effect is influenced by vitamin K, so maintaining consistent intake. A, ensures stable INR levels. Avoiding carbohydrates, B, increasing calcium, C, or limiting protein, D, is not relevant to warfarin therapy. 61. A patient with acute lymphoblastic leukemia is prescribed intrathecal chemotherapy. What is the nurse's priority action? A, monitor for signs of infection. B, ensure proper positioning during administration. C, encourage oral fluid restriction. D, apply ice to the injection site. Answer: B, ensure proper positioning during administration. Rationale: intrathecal chemotherapy requires precise positioning, B, typically lying flat post-procedure, to ensure drug distribution and prevent complications like headache. Monitoring for infection, A, is important but not specific to administration. Fluid restriction, C, is inappropriate. Ice, D, is not indicated. 62. A nurse is caring for a patient with a hemoglobin of 8G/DL. Which activities should be avoided? A, assisted ambulation. B, vigorous exercise. C, deep breathing exercises. D, eating a balanced meal. Answer: B, vigorous exercise. Rationale: A hemoglobin of 8G/DL indicates severe anemia, reducing oxygen delivery. Vigorous exercise, B, increases oxygen demand and should be avoided. Assisted ambulation, A, deep breathing, C, and eating, D, are safe and beneficial. 63. A patient with a history of deep vein thrombosis reports leg swelling. What is the nurse's first action? A, elevate the leg. B, apply a warm compress. C, encourage ambulation. D, restrict fluid intake. Answer: A, elevate the leg. Rationale: leg swelling in DVT suggests venous obstruction. Elevating the leg, A, reduces swelling and promotes venous return. Warm compresses, B, may worsen swelling. Ambulation, C, risks dislodging a clot. Fluid restriction, D, is not indicated. 64. A nurse is teaching a patient with folate deficiency anemia. Which food should the nurse recommend? A, broccoli. B, milk. C, white rice. D, bananas. Answer: A, broccoli. Rationale: broccoli, A, is rich in folate, essential for treating folate deficiency anemia. Milk, B, white rice, C, and bananas, D, are low in folate and not effective for this condition. 65. A patient with polycythemia vera reports headache and dizziness. What is the nurse's priority action? A, administer analgesics. B, assess for dehydration. C, encourage bed rest. D, restrict dietary iron. Answer: B, assess for dehydration. Rationale: headache and dizziness in polycythemia vera may result from hyperviscosity or dehydration. Assessing for dehydration, B, is the priority to guide treatment. Analgesics, A, treat symptoms, not the cause. Bed rest, C, is not specific. Iron restriction, D, is not relevant. 66. A nurse is caring for a patient receiving a blood transfusion. Which action prevents a transfusion reaction? A, infuse rapidly within 1 hour. B, verify patient identity and blood type. C, use saline as a priming solution. D, administer without checking vital signs. Answer: B, verify patient identity and blood type. Rationale: verifying patient identity and blood type, B, prevents ABO incompatibility reactions. Rapid infusion, A, risks fluid overload. Saline, C, is standard but not the primary preventive action. Checking vital signs, D, is essential to detect reactions early. 67. A patient with aplastic anemia reports bruising. What is the nurse's priority intervention? A, apply pressure to bruised areas. B, encourage vigorous activity. C, administer oral iron. D, restrict dietary vitamin K. Answer: A, apply pressure to bruised areas. Rationale: aplastic anemia causes thrombocytopenia, increasing bruising risk. Applying pressure, A, minimizes bleeding. Vigorous activity, B, increases bleeding risk. Iron, C, is not indicated for aplastic anemia. Vitamin K restriction, D, is irrelevant. 68. A nurse is assessing a patient with a suspected clotting disorder. Which history finding is most concerning? A, frequent nosebleeds. B, occasional headaches. C, mild fatigue. D, dry skin. Answer: A, frequent nosebleeds. Rationale: frequent nosebleeds, A, suggest a clotting disorder such as thrombocytopenia or coagulopathy and require further investigation. Headaches, B, fatigue, C, and dry skin, D, are less specific to clotting disorders. 69. A patient with chronic myeloid leukemia is prescribed dasatinib. What should the nurse monitor? A, blood pressure. B, platelet count. C, blood glucose. D, respiratory rate. Answer: B, platelet count. Rationale: dasatinib can cause thrombocytopenia, so monitoring platelet count, B, is critical to detect bleeding risk. Blood pressure, A, blood glucose, C, and respiratory rate, D, are not primary concerns with dasatinib. 70. A nurse is caring for a patient with a history of heparin-induced thrombocytopenia, HIT. Which anticoagulant is contraindicated? A. Argatrobin. B. Fondaparinux. C. Enoxaparin. D. Bivalirudin. Answer: C. Enoxaparin. Rationale: enoxaparin, C, a low-molecular-weight heparin, is contraindicated in HIT due to cross-reactivity with heparin antibodies. Argatrobin, A, fondaparinux, B, and bivalirudin, D, are safe alternatives for HIT patients. 71. A patient with sickle cell anemia is admitted with a fever. What is the nurse's priority action? A. Administer antipyretics. B. Obtain blood cultures. C. Restrict oral fluids. D. Apply a warm compress. Answer: B. Obtain blood cultures. Rationale: fever in sickle cell anemia suggests possible infection, a serious complication. Obtaining blood cultures, B, identifies the cause and guides treatment. Antipyretics, A, treat symptoms. Fluid restriction, C, is inappropriate. Warm compresses, D, are not indicated. 72. A nurse is teaching a patient with hemophilia about medication safety. Which instruction is most important? A. Avoid aspirin. B. Increase vitamin C intake. C. Take medications with meals. D. Limit fluid intake. Answer: A. Avoid aspirin. Rationale: aspirin, A, inhibits platelet function, increasing bleeding risk in hemophilia, so avoiding it is critical. Vitamin C, B, is not related to bleeding. Taking medications with meals, C, is not specific. Fluid restriction, D, is unnecessary. 73. A patient with multiple myeloma reports nausea and confusion. What should the nurse suspect? A. Hypercalcemia. B. Hypoglycemia. C. Hyponatremia. D. Hyperkalemia. Answer: A. Hypercalcemia. Rationale: nausea and confusion in multiple myeloma suggest hypercalcemia, A, due to bone destruction. Hypoglycemia, B, hyponatremia, C, and hyperkalemia, D, are less likely without specific risk factors. 74. A nurse is caring for a patient with a history of blood transfusions. Which lab test monitors for transfusion-related complications? A. Serum ferritin. B. Blood urea nitrogen. C. Serum sodium. D. Fasting glucose. Answer: A. Serum ferritin. Rationale: serum ferritin, A, monitors iron overload, a complication of frequent transfusions. Blood urea nitrogen, B, serum sodium, C, and fasting glucose, D, are not specific to transfusion complications. 75. A patient with thrombocytopenia reports gingival bleeding. What should the nurse recommend? A. Use a soft toothbrush. B. Brush vigorously. C. Avoid oral hygiene. D. Use a hard toothbrush. Answer: A. Use a soft toothbrush. Rationale: gingival bleeding in thrombocytopenia requires gentle oral care with a soft toothbrush, A, to prevent further bleeding. Vigorous brushing, B, or hard toothbrushes, D, worsen bleeding. Avoiding oral hygiene, C, increases infection risk. 76. A nurse is reviewing a patient's lab results showing a hemoglobin of 9G/DL. Which intervention is most appropriate? A. Encourage high-impact exercise. B. Prepare for blood transfusion. C. Restrict dietary iron. D. Administer diuretics. Answer: B. Prepare for blood transfusion. Rationale: a hemoglobin of 9G/DL indicates moderate to severe anemia, often requiring a blood transfusion, B, if symptomatic. High-impact exercise, A, is unsafe. Iron restriction, C, worsens anemia. Diuretics, D, are unrelated. 77. A patient with Hodgkin lymphoma is receiving radiation therapy. What should the nurse teach the patient? A. Avoid skincare products on the treatment area. B. Apply heat to the treatment site. C. Increase sun exposure. D. Use abrasive soaps on the skin. Answer: A. Avoid skin care products on the treatment area. Rationale: radiation therapy irritates the skin, so avoiding skincare products. A. On the treatment area prevents further irritation. Heat, B. And abrasive soaps, D. Worsen skin damage. Sun exposure, C. Increases burn risk. 78. A nurse is caring for a patient with a prolonged INR. Which food should the patient avoid? A. Spinach. B. Chicken. C. Rice. D. Apples. Answer: A. Spinach. Rationale: a prolonged INR suggests excessive anticoagulation, often from warfarin. Spinach, A, is high in vitamin K, which can reverse warfarin's effect, requiring dietary consistency. Chicken, B, rice, C, and apples, D, do not significantly affect INR. 79. A patient with sickle cell disease is prescribed hydroxyurea. What is the primary purpose of this medication? A. Reduce pain. B. Increase hemoglobin production. C. Prevent vaso-occlusive crises. D. Enhance immune function. Answer: C. Prevent vaso-occlusive crises. Rationale: hydroxyurea increases fetal hemoglobin, reducing sickle cell formation and preventing vaso-occlusive crises. C. It does not directly reduce pain. A. Increase hemoglobin. B. Or enhance immunity. D. 80. A nurse is assessing a patient with suspected anemia. Which physical finding supports this diagnosis? A. Pallor. B. Hypertension. C. Fever. D. Weight gain. Answer: A. Pallor. Rationale: pallor, A, is a classic sign of anemia due to reduced hemoglobin. Hypertension, B, fever, C, and weight gain, D, are not specific to anemia. 81. A patient with chronic lymphocytic leukemia is prescribed rituximab. What should the nurse monitor during infusion? A. Blood glucose. B. Infusion-related reactions. C. Urine output. D. Skin turgor. Answer: B. Infusion-related reactions. Rationale: rituximab can cause infusion-related reactions, e.g., fever, chills, so monitoring for these, B, is critical during administration. Blood glucose, A, urine output, C, and skin turgor, D, are not primary concerns. 82. A nurse is caring for a patient with a history of pulmonary embolism. Which diagnostic test confirms the diagnosis? A. Complete blood count. B. Chest X-ray. C. Spiral CT scan. D. Electrocardiogram. Answer: C. Spiral CT scan. Rationale: a spiral CT scan, C, is the gold standard for diagnosing pulmonary embolism, visualizing clots in the pulmonary arteries. Complete blood count, A, chest X-ray, B, and electrocardiogram, D, are not specific for confirming pulmonary embolism. 83. A patient with iron deficiency anemia reports fatigue. Which lab result confirms the diagnosis? A. Decreased serum ferritin. B. Increased hemoglobin. C. Normal hematocrit. D. Elevated platelet count. Answer: A. Decreased serum ferritin. Rationale: decreased serum ferritin, A, indicates low iron stores, confirming iron deficiency anemia. Increased hemoglobin, B, and normal hematocrit, C, are inconsistent with anemia. Elevated platelets, D, are not specific to this diagnosis. 84. A nurse is caring for a patient with a history of hemophilia. Which activity should the patient avoid? A. Swimming. B. Weightlifting. C. Walking. D. Yoga. Answer: B. Weightlifting. Rationale: weightlifting, B, poses a high risk of trauma and bleeding in hemophilia. Swimming, A, walking, C, and yoga, D, are low impact and generally safe with precautions. 85. A patient with thrombocytopenia is prescribed corticosteroids. What is the purpose of this medication? A. Increase platelet production. B. Reduce pain. C. Enhance red blood cell production. D. Prevent infection. Answer: A. Increase platelet production. Rationale: corticosteroids, A, are used in thrombocytopenia, e.g., in immune thrombocytopenia, to suppress immune-mediated platelet destruction, increasing platelet production. They do not reduce pain, B, enhance red blood cells, C, or prevent infection, D. 86. A patient with sickle cell anemia reports shortness of breath. What is the nurse's priority action? A. Administer pain medication. B. Assess lung sounds. C. Encourage deep breathing. D. Restrict fluid intake. Answer: B. Assess lung sounds. Rationale: shortness of breath in sickle cell anemia may indicate acute chest syndrome or other pulmonary complications. Assessing lung sounds, B, is the priority to identify abnormalities. Pain medication, A, is not indicated for shortness of breath. Deep breathing, C, is beneficial but secondary to assessment. Fluid restriction, D, is contraindicated as hydration is essential. 87. A nurse is caring for a patient with a history of warfarin use. Which symptom indicates a potential overdose? A. Bruising. B. Weight loss. C. Fever. D. Dry mouth. Answer: A. Bruising. Rationale: warfarin overdose increases bleeding risk, with bruising, A, being a common sign due to excessive anticoagulation. Weight loss, B, fever, C, and dry mouth, D, are not directly related to warfarin overdose. 88. A patient with leukemia is prescribed allopurinol. What is the purpose of this medication? A. Prevent infection. B. Reduce tumor lysis syndrome. C. Increase platelet production. D. Enhance red blood cell production. Answer: B. Reduce tumor lysis syndrome. Rationale: allopurinol reduces uric acid levels, preventing tumor lysis syndrome, B, in leukemia patients undergoing chemotherapy. It does not prevent infection, A, increase platelets, C, or enhance red blood cells, D. 89. A nurse is monitoring a patient receiving a blood transfusion. Which vital sign change requires immediate action? A. Temperature increase to 100.4 degrees Fahrenheit. B. Heart rate decrease to 60 bpm. C. Blood pressure increase to 130/80 mmHg. D. Respiratory rate of 18 breaths/min. Answer: A. Temperature increase to 100.4 degrees Fahrenheit. Rationale: a temperature increase, A, during a blood transfusion suggests a febrile non-hemolytic reaction, requiring immediate stopping of the transfusion. A heart rate of 60 bpm, B, blood pressure of 130/80 mmHg, C, and respiratory rate of 18 breaths/min, D, are within normal limits and not indicative of a reaction. 90. A patient with iron deficiency anemia is prescribed iron supplements. What should the nurse teach about side effects? A. Expect orange-colored urine. B. Monitor for constipation. C. Anticipate weight loss. D. Watch for increased appetite. Answer: B. Monitor for constipation. Rationale: constipation, B, is a common side effect of iron supplements due to their effect on the gastrointestinal tract. Orange-colored urine, A, is associated with other medications, e.g., rifampin. Weight loss, C, and increased appetite, D, are not typical side effects. 91. A patient with hemophilia A is admitted with abdominal pain. What should the nurse suspect? A. Internal bleeding. B. Appendicitis. C. Gastritis. D. Constipation. Answer: A. Internal bleeding. Rationale: abdominal pain in hemophilia A likely indicates internal bleeding, A, due to impaired clotting. Appendicitis, B, gastritis, C, and constipation, D, are possible but less likely without additional symptoms, and bleeding must be ruled out first. 92. A nurse is caring for a patient with a platelet count of 30,000/mm superscript 3. Which activities should be avoided? A. Using a soft toothbrush. B. Shaving with a straight razor. C. Assisted ambulation. D. Eating a balanced diet. Answer: B. Shaving with a straight razor. Rationale: a platelet count of 30,000/mm superscript 3 indicates severe thrombocytopenia, increasing bleeding risk. Shaving with a straight razor, B, can cause cuts and should be avoided. A soft toothbrush, A, assisted ambulation, C, and a balanced diet, D, are safe. 93. A patient with pernicious anemia reports fatigue. Which lab result confirms the diagnosis? A. Decreased vitamin B12. B. Increased hemoglobin. C. Normal serum folate. D. Elevated platelet count. Answer. A. Decreased vitamin B12. Rationale. Pernicious anemia is caused by vitamin B12 deficiency, confirmed by decreased vitamin B12 levels, A. Increased hemoglobin, B, and normal folate, C, are inconsistent with the diagnosis. Elevated platelets, D, are not specific to pernicious anemia. 94. A nurse is teaching a patient with sickle cell disease about preventing crises. Which instruction is most important? A. Maintain adequate hydration. B. Increase dietary sodium. C. Avoid low-impact exercise. D. Use heating pads for pain. Answer. A. Maintain adequate hydration. Rationale. Hydration. A. Reduces blood viscosity, preventing vaso-occlusive crises in sickle cell disease. Sodium intake. B. Is not directly related. Low-impact exercise, C, is safe and encouraged. Heating pads, D, are contraindicated as they may worsen vaso-occlusion. 95. A patient with multiple myeloma reports back pain. What is the nurse's priority action? A. Encourage spinal flexion exercises. B. Administer prescribed analgesics. C. Apply a warm compress. D. Restrict calcium intake. Answer. B. Administer prescribed analgesics. Rationale. Back pain in multiple myeloma is often due to bone lesions, requiring analgesics, B, for pain management. Spinal flexion exercises, A, may increase fracture risk. Warm compresses, C, are less effective for bone pain. Calcium intake, D, may be needed due to hypercalcemia risks. 96. A nurse is caring for a patient with a history of deep vein thrombosis, DVT. Which lab test monitors anticoagulant therapy? A. Hemoglobin. B. International Normalized Ratio, INR. C. White blood cell count. D. Serum creatinine. Answer. B. International Normalized Ratio, INR. Rationale. INR, B, monitors warfarin therapy, commonly used for DVT, to ensure therapeutic anticoagulation. Hemoglobin, A, white blood cell count, C, and serum creatinine, D, are not specific to anticoagulant monitoring. 97. A patient with thalassemia major is scheduled for a blood transfusion. What should the nurse monitor post-transfusion? A. Serum ferritin levels. B. Blood glucose levels. C. Respiratory rate. D. Skin turgor. Answer. A. Serum ferritin levels. Rationale. Frequent transfusions in thalassemia major can cause iron overload, monitored by serum ferritin levels, A. Blood glucose, B. Respiratory rate, C. And skin turgor, D. are not directly related to transfusion complications. 98. A nurse is assessing a patient with suspected disseminated intravascular coagulation, DIC. Which symptom is most concerning? A. Petechiae. B. Blood pressure 120/80 mmHg. C. Heart rate 70 bpm. D. Temperature 98.6 degrees Fahrenheit. Answer. A. Petechiae. Rationale. Petechiae, A, indicate bleeding under the skin, a critical sign of DIC due to consumptive coagulopathy. Blood pressure, B, heart rate, C, and temperature, D, are normal and not specific to DIC. 99. A patient with chronic lymphocytic leukemia reports swollen lymph nodes. What should the nurse assess next? A. Presence of night sweats. B. Blood glucose levels. C. Joint range of motion. D. Skin hydration. Answer. A. Presence of night sweats. Rationale. Swollen lymph nodes in chronic lymphocytic leukemia may be accompanied by B symptoms like night sweats, A, indicating disease progression. Blood glucose, B, joint range of motion, C, and skin hydration, D, are not directly related to leukemia assessment. 100. A nurse is preparing a patient for a bone marrow aspiration. Which intervention ensures patient comfort? A. Administer a sedative as prescribed. B. Encourage vigorous activity pre-procedure. C. Apply a warm compress to the site. D. Restrict fluid intake. Answer: A. Administer a sedative as prescribed. Rationale: bone marrow aspiration is painful, so administering a sedative, A, ensures comfort. Vigorous activity, B, is not appropriate pre-procedure. Warm compresses, C, are not indicated. Fluid restriction, D, is unnecessary. 101. A patient with iron deficiency anemia reports dizziness. What is the nurse's first action? A. Encourage ambulation. B. Assess blood pressure. C. Administer pain medication. D. Restrict dietary iron. Answer: B. Assess blood pressure. Rationale: dizziness in iron deficiency anemia may indicate hypotension or hypoxia, so assessing blood pressure, B, is the first action to guide intervention. Ambulation, A, may worsen dizziness. Pain medication, C, is not indicated. Iron restriction, D, worsens anemia. 102. A nurse is caring for a patient with a history of heparin therapy. Which lab result indicates therapeutic effect? A. APTT of 70 seconds. B. INR of 1.2. C. Hemoglobin of 12G/DL. D. Platelet count of 150,000/mm superscript 3. Answer: A. APTT of 70 seconds. Rationale: heparin is monitored by APTT with a therapeutic range of 1.5 to 2.5 times the normal value, e.g., 60 to 80 seconds. An APTT of 70 seconds, A, indicates therapeutic anticoagulation. INR, B, monitors warfarin. Hemoglobin, C, and platelets, D, are not specific to heparin. 103. A patient with sickle cell disease is admitted with chest pain. What should the nurse suspect? A. Acute chest syndrome. B. Pneumonia. C. Heart failure. D. Costochondritis. Answer: A. Acute chest syndrome. Rationale: chest pain in sickle cell disease is concerning for acute chest syndrome. A life-threatening complication involving vaso-occlusion in the lungs. Pneumonia, B, heart failure, C, and costochondritis, D, are possible but less likely without specific symptoms. 104. A nurse is teaching a patient with hemophilia about safety precautions. Which instruction is most important? A. Use a soft toothbrush. B. Avoid contact sports. C. Increase dietary calcium. D. Wear loose clothing. Answer: B. Avoid contact sports. Rationale: contact sports, B, pose a high risk of trauma and bleeding in hemophilia, making avoidance critical. A soft toothbrush, A, is important but secondary. Calcium intake, C, is unrelated to bleeding. Loose clothing, D, does not prevent injury. 105. A patient with multiple myeloma is prescribed bisphosphonates. What is the purpose of this medication? A. Reduce bone pain. B. Increase platelet production. C. Prevent infection. D. Enhance red blood cell production. Answer: A. Reduce bone pain. Rationale: bisphosphonates, A, strengthen bones and reduce pain from lytic lesions in multiple myeloma. They do not increase platelets, B, prevent infection, C, or enhance red blood cells, D. 106. A nurse is caring for a patient with a history of pulmonary embolism. Which instruction promotes recovery? A. Wear compression stockings. B. Restrict physical activity. C. Increase dietary sodium. D. Apply heat to the chest. Answer: A. Wear compression stockings. Rationale: compression stockings, A, promote venous return, reducing the risk of further clots in pulmonary embolism recovery. Restricting activity, B, is unnecessary long-term. Sodium intake, C, is unrelated. Heat, D, is not indicated for pulmonary embolism. 107. A patient with aplastic anemia reports fatigue. What is the nurse's priority action? A. Assess hemoglobin levels. B. Encourage vigorous exercise. C. Administer oral iron. D. Restrict fluid intake. Answer: A. Assess hemoglobin levels. Rationale: fatigue in aplastic anemia is likely due to anemia, so assessing hemoglobin levels, A, guides treatment. Vigorous exercise, B, is unsafe. Iron, C, is not effective for aplastic anemia. Fluid restriction, D, is unnecessary. 108. A nurse is monitoring a patient receiving rituximab for lymphoma. Which side effect requires immediate intervention? A. Mild nausea. B. Fever and chills. C. Increased appetite. D. Dry skin. Answer: B. Fever and chills. Rationale: fever and chills, B, during rituximab infusion indicate a possible infusion reaction, requiring immediate intervention, such as slowing or stopping the infusion. Mild nausea, A, increased appetite, C, and dry skin, D, are less urgent. 109. A patient with iron deficiency anemia is prescribed ferrous gluconate. What should the nurse teach about administration? A. Take with a high-fat meal. B. Take with vitamin C. C. Take with milk.
D. Take at bedtime.
Answer: B. Take with vitamin C. Rationale: vitamin C, B, enhances iron absorption, improving the effectiveness of ferrous gluconate. High-fat meals, A, and milk, C, reduce absorption. Bedtime, D, is not optimal for absorption. 110. A nurse is caring for a patient with a prolonged APTT. Which medication should the nurse prepare to discontinue? A. Warfarin. B. Heparin. C. Aspirin. D. Clopidogrel. Answer: B. Heparin. Rationale: a prolonged APTT is associated with heparin B, and discontinuation may be needed if the value is excessively high to prevent bleeding. Warfarin, A, affects INR. Aspirin, C, and clopidogrel, D, do not significantly affect APTT. 111. A patient with sickle cell anemia reports leg pain. What is the nurse's first action? A. Apply a heating pad. B. Administer prescribed analgesics. C. Encourage ambulation. D. Restrict fluid intake. Answer: B. Administer prescribed analgesics. Rationale: leg pain in sickle cell anemia is likely due to vaso-occlusion, requiring analgesics, B, as the first action. Heating pads, A, are contraindicated. Ambulation, C, may worsen pain. Fluid restriction, D, is inappropriate as hydration is needed. 112. A nurse is assessing a patient with suspected thrombocytopenia. Which physical findings supports this diagnosis? A. Ecchymosis. B. Hypertension. C. Fever. D. Weight loss. Answer: A. Ecchymosis. Rationale: ecchymosis, A, bruising, is a common sign of thrombocytopenia due to low platelets. Hypertension, B, fever, C, and weight loss, D, are not specific to thrombocytopenia. 113. A patient with chronic myeloid leukemia is prescribed imatinib. What should the nurse teach the patient? A. Take with a high-fat meal. B. Monitor for signs of bleeding. C. Avoid grapefruit juice. D. Increase dietary sodium. Answer: C. Avoid grapefruit juice. Rationale: grapefruit juice, C, can interfere with imatinib metabolism, affecting its efficacy. High-fat meals, A, are not required. Bleeding, B, is not a primary concern with imatinib. Sodium intake, D, is unrelated. 114. A nurse is caring for a patient with a history of hemophilia A. Which lab test monitors disease management? A. Platelet count. B. Factor VIII levels. C. Hemoglobin. D. White blood cell count. Answer: B. Factor VIII levels. Rationale: hemophilia A is caused by Factor VIII deficiency, so monitoring Factor VIII levels, B, assesses treatment effectiveness. Platelet count, A, hemoglobin, C, and white blood cell count, D, are not specific to hemophilia management. 115. A patient with polycythemia vera is prescribed phlebotomy. What is the purpose of this procedure? A. Reduce blood viscosity. B. Increase platelet production. C. Prevent infection. D. Enhance immune response. Answer. A. Reduce blood viscosity. Rationale. Phlebotomy. A. Removes excess red blood cells in polycythemia vera, reducing blood viscosity and thrombosis risk. It does not increase platelets. B. Prevent infection. C. Or enhance immunity. D. 116. A nurse is teaching a patient with folate deficiency anemia about dietary changes. Which food is most beneficial? A. Lentils. B. White bread. C. Milk. D. Apples. Answer. A. Lentils. Rationale. Lentils, A, are high in folate, essential for treating folate deficiency anemia. White bread, B, milk, C, and apples, D, are low in folate and not effective for this condition. 117. A patient with lymphoma reports fatigue and fever. What is the nurse's priority action? A. Administer antipyretics. B. Assess for infection. C. Encourage high-calorie snacks. D. Restrict fluid intake. Answer. B. Assess for infection. Rationale. Fatigue and fever in lymphoma suggest infection due to immunosuppression, so assessing for infection, B, is the priority. Antipyretics, A, treat symptoms. High-calorie snacks, C, support nutrition but are secondary. Fluid restriction, D, is inappropriate. 118. A nurse is caring for a patient receiving a platelet transfusion. Which symptom indicates a transfusion reaction? A. Increased energy. B. Urticaria. C. Improved skin color. D. Decreased heart rate. Answer. B. Urticaria. Rationale. Urticaria, B. Hives, indicates an allergic transfusion reaction requiring immediate intervention. Increased energy, A. Improved skin color, C. And decreased heart rate, D. Suggest a positive response, not a reaction. 119. A patient with thalassemia major reports shortness of breath. What should the nurse assess first? A. Oxygen saturation. B. Blood glucose. C. Skin turgor. D. Joint range of motion. Answer. A. Oxygen saturation. Rationale. Shortness of breath in thalassemia major is likely due to anemia, so assessing oxygen saturation, A, is the first step to evaluate hypoxia. Blood glucose, B, skin turgor, C, and joint range of motion, D, are not directly related to this symptom. 120. A nurse is caring for a patient with a prolonged INR of 4.8. What is the nurse's first action? A. Administer vitamin K. B. Increase warfarin dose. C. Encourage green leafy vegetables. D. Continue current therapy. Answer. A. Administer vitamin K. Rationale. An INR of 4.8 indicates excessive anticoagulation, increasing bleeding risk. Administering vitamin K, A, reverses warfarin's effect. Increasing warfarin, B, worsens the risk. Green leafy vegetables, C, reduce warfarin's effect, but are not immediate. Continuing therapy, D, is unsafe. 121. A patient with sickle cell anemia is prescribed oxygen therapy. What is the primary purpose? A. Reduce pain. B. Improve oxygenation. C. Prevent infection. D. Enhance platelet production. Answer. B. Improve oxygenation. Rationale. Oxygen therapy, B, improves oxygenation in sickle cell anemia, addressing hypoxia from vaso-occlusion or anemia. It does not reduce pain, A, prevent infection, C, or enhance platelets, D. 122. A nurse is assessing a patient with suspected von Willebrand disease. Which history finding supports this diagnosis? A. Prolonged menstrual bleeding. B. Occasional headaches. C. Mild fatigue. D. Dry skin. Answer. A. Prolonged menstrual bleeding. Rationale. Prolonged menstrual bleeding, A, is a common sign of von Willebrand disease due to impaired clotting. Headaches, B, fatigue, C, and dry skin, D, are not specific to this condition. 123. A patient with chronic lymphocytic leukemia is prescribed prednisone. What should the nurse monitor? A. Blood glucose levels. B. Platelet count. C. Blood pressure. D. Respiratory rate. Answer: A. Blood glucose levels. Rationale: prednisone can cause hyperglycemia, so monitoring blood glucose levels, A, is critical. Platelet count, B, blood pressure, C, and respiratory rate, D, are not primary concerns with prednisone. 124. A nurse is caring for a patient with a history of blood transfusions. Which symptom indicates iron overload? A. Darkened skin. B. Increased appetite. C. Fever. D. Weight loss. Answer: A. Darkened skin. Rationale: iron overload from frequent transfusions can cause darkened skin, A. Due to hemosiderin deposition. Increased appetite, B. Fever, C. And weight loss, D. are not typical signs of iron overload. 125. A patient with thrombocytopenia is at risk for bleeding. Which intervention is most appropriate? A. Encourage vigorous oral hygiene. B. Use a soft bristled toothbrush. C. Allow unrestricted ambulation. D. Apply heat to bruised areas. Answer: B. Use a soft bristled toothbrush. Rationale: a soft bristled toothbrush, B, prevents gingival bleeding in thrombocytopenia. Vigorous oral hygiene, A, increases bleeding risk. Unrestricted ambulation, C, risks injury. Heat, D, worsens bruising. 126. A patient with sickle cell anemia is experiencing a vaso-occlusive crisis. Which intervention is most effective? A. Apply a heating pad. B. Administer 4 fluids. C. Restrict oral intake. D. Encourage vigorous exercise. Answer: B. Administer 4 fluids. Rationale: 4 fluids, B, reduce blood viscosity and promote circulation, helping to alleviate a vaso-occlusive crisis in sickle cell anemia. Heating pads, A, may worsen vaso-occlusion. Restricting oral intake, C, is contraindicated as hydration is critical. Vigorous exercise, D, increases oxygen demand and may exacerbate the crisis. 127. A nurse is monitoring a patient receiving warfarin. Which lab result indicates a therapeutic level? A. INR of 2.5. B. APTT of 60 seconds. C. Platelet count of 150,000/mm superscript 3. D. Hemoglobin of 12G/DL. Answer: A. INR of 2.5. Rationale: a therapeutic INR for warfarin is typically 2.0 to 3.0, A, indicating effective anticoagulation. APTT, B, monitors heparin. Platelet count, C, and hemoglobin, D, are not specific to warfarin therapy. 128. A patient with pernicious anemia is prescribed cyanocobalamin. What should the nurse teach the patient? A. Expect lifelong therapy. B. Take orally with meals. C. Discontinue after 1 month. D. Avoid vitamin C supplements. Answer: A. Expect lifelong therapy. Rationale: pernicious anemia requires lifelong cyanocobalamin, vitamin B12, therapy, A, due to intrinsic factor deficiency. Oral administration, B, is ineffective. Discontinuing after 1 month, C, is incorrect. Vitamin C, D, does not interfere with B12. 129. A nurse is caring for a patient with leukemia who reports bone pain. What is the nurse's best action? A. Encourage weight-bearing exercises. B. Administer prescribed analgesics. C. Apply ice to affected areas. D. Restrict calcium supplements. Answer: B. Administer prescribed analgesics. Rationale: bone pain in leukemia is common due to marrow infiltration, requiring analgesics, B, for relief. Weight-bearing exercises, A, may worsen pain. Ice, C, is less effective for bone pain. Calcium supplements, D, are not contraindicated unless hypercalcemia is present. 130. A patient with a hemoglobin of 6G/DL is scheduled for a blood transfusion. What should the nurse verify before starting? A. Patient's blood type and cross-match. B. Patient's dietary preferences. C. Blood glucose levels. D. Respiratory rate. Answer: A. Patient's blood type and cross-match. Rationale. Verifying blood type and cross-match A ensures compatibility, preventing transfusion reactions. Dietary preferences B. Blood glucose C. and respiratory rate D. are not relevant to transfusion safety. 131. A patient with hemophilia B reports a swollen elbow. What is the nurse's first action? A. Apply a warm compress. B. Administer factor IX. C. Encourage active range of motion. D. Restrict ice application. Answer. B. Administer factor IX. Rationale. A swollen elbow in hemophilia B suggests joint bleeding, requiring factor IX B to stop bleeding. Warm compresses A. worsen bleeding. Active range of motion C. may increase bleeding. Ice D. is helpful but secondary to factor replacement. 132. A nurse is caring for a patient with thrombocytopenia. Which precaution is most important? A. Avoid intramuscular injections. B. Encourage vigorous toothbrushing. C. Allow unrestricted ambulation. D. Apply heat to bruised areas. Answer. A. Avoid intramuscular injections. Rationale. Thrombocytopenia increases bleeding risk, so avoiding intramuscular injections A. prevents hematomas. Vigorous toothbrushing B. may cause gingival bleeding. Unrestricted ambulation C. risks injury. Heat D. worsens bruising. 133. A patient with polycythemia vera reports blurred vision. What should the nurse suspect? A. Hyperviscosity. B. Hypoglycemia. C. Dehydration. D. Infection. Answer. A. Hyperviscosity. Rationale. Blurred vision in polycythemia vera is likely due to hyperviscosity A. from increased red blood cells, impairing blood flow. Hypoglycemia B. Dehydration C. and infection D. are less likely without specific symptoms. 134. A nurse is teaching a patient with iron deficiency anemia about dietary changes. Which food should the nurse recommend? A. Red meat. B. White bread. C. Milk. D. Bananas. Answer. A. Red meat. Rationale. Red meat A. is high in heme iron, which is easily absorbed and beneficial for iron deficiency anemia. White bread B. Milk C. and bananas D. are low in iron. 135. A patient with disseminated intravascular coagulation DIC reports epistaxis. What is the nurse's priority action? A. Apply nasal packing. B. Assess vital signs. C. Encourage ambulation. D. Restrict fluid intake. Answer. B. Assess vital signs. Rationale. Epistaxis in DIC indicates bleeding, so assessing vital signs B. evaluates for hemodynamic instability. Nasal packing A. may be needed but is secondary. Ambulation C. increases bleeding risk. Fluid restriction D. is inappropriate as hydration supports circulation. 136. A nurse is caring for a patient with a history of pulmonary embolism. Which medication is most likely prescribed? A. Aspirin. B. Enoxaparin. C. Clopidogrel. D. Iron supplements. Answer. B. Enoxaparin. Rationale. Enoxaparin B. a low molecular weight heparin, is commonly prescribed for pulmonary embolism to prevent further clotting. Aspirin A and clopidogrel C are antiplatelet agents, not primary for embolism. Iron supplements D are unrelated. 137. A patient with sickle cell disease is prescribed hydroxyurea. What should the nurse monitor? A. White blood cell count. B. Blood glucose levels. C. Blood pressure. D. Skin turgor. Answer. A. White blood cell count. Rationale. Hydroxyurea can cause myelosuppression, so monitoring white blood cell count A is critical to detect neutropenia. Blood glucose B, blood pressure C, and skin turgor D are not primary concerns with hydroxyurea. 138. A nurse is assessing a patient with suspected aplastic anemia. Which lab result supports this diagnosis? A. Pancytopenia. B. Increased hemoglobin. C. Elevated platelet count. D. Normal white blood cell count. Answer. A. Pancytopenia. Rationale. Aplastic anemia causes bone marrow failure, leading to pancytopenia. A. Low red cells, white cells, and platelets. Increased hemoglobin. B. Elevated platelets. C. And normal white cell count. D. Are inconsistent with aplastic anemia. 139. A patient with multiple myeloma reports constipation. What is the nurse's best action? A. Encourage a high-fiber diet. B. Restrict fluid intake. C. Administer analgesics. D. Apply a warm compress. Answer. A. Encourage a high-fiber diet. Rationale. Constipation in multiple myeloma may be due to medications or immobility, so a high-fiber diet, A. Promotes bowel regularity. Fluid restriction, B. Worsens constipation. Analgesics, C. Are not indicated. Warm compresses, D. Are ineffective for constipation. 140. A nurse is caring for a patient receiving a blood transfusion. Which action ensures safety? A. Infuse over 6 hours. B. Use a dedicated 4-line. C. Mix with dextrose solution. D. Administer without a filter. Answer. B. Use a dedicated 4-line. Rationale. A dedicated 4-line, B. Prevents mixing with other medications, ensuring transfusion safety. Blood is infused over 2 to 4 hours, not 6 hours. A. Dextrose, C. Causes hemolysis. A filter, D. Is required to remove clots. 141. A patient with iron deficiency anemia reports nausea from iron supplements. What should the nurse suggest? A. Take with meals. B. Stop the supplement. C. Take with milk. D. Increase the dose. Answer. A. Take with meals. Rationale. Taking iron supplements with meals, A. Reduces nausea, though it may slightly decrease absorption. Stopping the supplement, B. Is not advisable without consultation. Milk, C. Reduces absorption. Increasing the dose, D. Worsens nausea. 142. A nurse is caring for a patient with a history of hemophilia. Which medication should the patient avoid? A. Ibuprofen. B. Acetaminophen. C. Vitamin C. D. Calcium supplements. Answer. A. Ibuprofen. Rationale. Ibuprofen, A. Inhibits platelet function, increasing bleeding risk in hemophilia. Acetaminophen, B. Is safe for pain. Vitamin C, C, and calcium, D. Do not affect bleeding. 143. A patient with chronic lymphocytic leukemia reports fatigue. What should the nurse assess first? A. Hemoglobin level. B. Blood glucose. C. Respiratory rate. D. Skin integrity. Answer. A. Hemoglobin level. Rationale. Fatigue in chronic lymphocytic leukemia is often due to anemia, so assessing hemoglobin level, A, is the first step. Blood glucose, B, respiratory rate, C, and skin integrity, D, are not directly related to fatigue in this context. 144. A nurse is preparing a patient for a splenectomy due to hemolytic anemia. What is the priority teaching? A. Importance of vaccination. B. Need for a low-iron diet. C. Avoidance of deep breathing. D. Restriction of physical activity. Answer. A. Importance of vaccination. Rationale. Splenectomy increases infection risk, so vaccinations, e.g. pneumococcal, are critical pre-surgery. A low-iron diet, B, is not indicated. Deep breathing, C, prevents complications. Activity restriction, D, is temporary but not the priority. 145. A patient with thrombocytopenia reports a headache. What is the nurse's first action? A. Administer aspirin. B. Assess for neurological changes. C. Encourage ambulation. D. Apply a warm compress. Answer. B. Assess for neurological changes. Rationale. A headache in thrombocytopenia may indicate intracranial bleeding, so assessing for neurological changes, B, is the priority. Aspirin, A, increases bleeding risk. Ambulation, C, is unsafe until bleeding is ruled out. Warm compresses, D, are ineffective. 146. A nurse is caring for a patient with a prolonged PT/INR. Which medication is likely responsible? A. Heparin. B. Warfarin. C. Enoxaparin. D. Aspirin. Answer: B. Warfarin. Rationale: Warfarin B. prolongs PT/INR, used to monitor its anticoagulant effect. Heparin A and enoxaparin C. affect APTT. Aspirin D. affects platelet function, not PT/INR. 147. A patient with sickle cell anemia is admitted with fever and cough. What should the nurse suspect? A. Acute chest syndrome. B. Asthma exacerbation. C. Heart failure. D. Allergic reaction. Answer: A. Acute chest syndrome. Rationale: fever and cough in sickle cell anemia suggest acute chest syndrome. A serious complication involving pulmonary vasoocclusion. Asthma B. Heart failure C. and allergic reactions D. are less likely without specific symptoms. 148. A nurse is teaching a patient with folate deficiency anemia. Which supplement should the nurse recommend? A. Folic acid. B. Vitamin B12. C. Iron. D. Vitamin D. Answer: A. Folic acid. Rationale: folic acid A. corrects folate deficiency anemia. Vitamin B12 B. treats pernicious anemia. Iron C. is for iron deficiency anemia. Vitamin D is unrelated to anemia. 149. A patient with multiple myeloma is at risk for which complication? A. Renal failure. B. Hypoglycemia. C. Hypertension. D. Osteoarthritis. Answer: A. Renal failure. Rationale: multiple myeloma can cause renal failure, A. due to hypercalcemia and protein deposition. Hypoglycemia, B. hypertension, C. and osteoarthritis, D. are not primary complications. 150. A nurse is caring for a patient receiving a blood transfusion. Which symptom indicates fluid overload? A. Dyspnea. B. Fever. C. Urticaria. D. Chills. Answer: A. Dyspnea. Rationale: dyspnea A. is a sign of fluid overload during a blood transfusion, indicating pulmonary edema. Fever B. Urticaria C. and chills D. suggest other transfusion reactions, febrile or allergic. 151. A patient with iron deficiency anemia reports palpitations. What is the nurse's priority action? A. Assess heart rate. B. Encourage vigorous exercise. C. Restrict dietary iron. D. Apply a warm compress. Answer: A. Assess heart rate. Rationale: palpitations in iron deficiency anemia may indicate tachycardia due to reduced oxygen delivery, so assessing heart rate, A. is the priority. Vigorous exercise, B. is unsafe. Iron restriction, C. worsens anemia. Warm compresses, D. are irrelevant. 152. A nurse is caring for a patient with a history of heparin-induced thrombocytopenia, HIT. Which anticoagulant is safe? A. Enoxaparin. B. Argatrobin. C. Heparin. D. Warfarin. Answer: B. Argatrobin. Rationale: Argatrobin B. a direct thrombin inhibitor, is safe for HIT. Enoxaparin A. and heparin C. are contraindicated due to HIT. Warfarin D. is not ideal initially due to delayed onset. 153. A patient with sickle cell disease reports abdominal pain. What should the nurse assess first? A. Bowel sounds. B. Blood pressure. C. Skin turgor. D. Joint mobility. Answer: B. Blood pressure. Rationale: abdominal pain in sickle cell disease may indicate vasoocclusion or organ ischemia, so assessing blood pressure, B. evaluates hemodynamic stability. Bowel sounds, A. Skin turgor, C. and joint mobility, D. are secondary. 154. A nurse is teaching a patient with hemophilia about injury prevention. Which instruction is most important? A. Avoid sharp objects. B. Increase dietary sodium. C. Wear loose clothing. D. Limit fluid intake. Answer. A. Avoid sharp objects. Rationale. Avoiding sharp objects, A. Prevents cuts and bleeding in hemophilia, a critical safety measure. Sodium intake, B. Loose clothing, C. And fluid intake, D. Are not directly related to injury prevention. 155. A patient with chronic lymphocytic leukemia is prescribed chemotherapy. What is the nurse's priority teaching? A. Monitor for signs of infection. B. Maintain a low-protein diet. C. Avoid deep breathing exercises. D. Increase sun exposure. Answer. A. Monitor for signs of infection. Rationale. Chemotherapy causes immunosuppression, increasing infection risk, so monitoring for infection signs, A, is critical. Low-protein diet, B, is not indicated. Deep breathing, C, prevents complications. Sun exposure, D, increases skin damage risk. 156. A nurse is caring for a patient with a platelet count of 25,000/mm superscript 3. Which intervention is most appropriate? A. Encourage contact sports. B. Use an electric razor. C. Apply warm compresses. D. Allow vigorous oral hygiene. Answer. B. Use an electric razor. Rationale. A platelet count of 25,000/mm superscript 3 indicates severe thrombocytopenia, so using an electric razor, B, prevents bleeding from cuts. Contact sports, A, and vigorous oral hygiene, D, increase bleeding risk. Warm compresses, C, worsen bruising. 157. A patient with pernicious anemia reports difficulty walking. What should the nurse suspect? A. Neuropathy. B. Muscle strain. C. Joint inflammation. D. Dehydration. Answer. A. Neuropathy. Rationale. Difficulty walking in pernicious anemia suggests neuropathy, A, due to vitamin B12 deficiency affecting nerves. Muscle strain, B, joint inflammation, C, and dehydration, D, are less likely without specific symptoms. 158. A nurse is monitoring a patient receiving fresh frozen plasma. What is the nurse's priority action? A. Check vital signs frequently. B. Encourage ambulation. C. Restrict fluid intake. D. Apply a warm compress. Answer. A. Check vital signs frequently. Rationale. Frequent vital sign checks. A. Detect transfusion reactions during fresh frozen plasma administration. Ambulation, B, is not a priority. Fluid restriction, C, is inappropriate. Warm compresses, D, are irrelevant. 159. A patient with polycythemia vera is prescribed low-dose aspirin. What is the purpose of this medication? A. Reduce thrombosis risk. B. Increase red blood cell production. C. Prevent infection. D. Enhance immune response. Answer. A. Reduce thrombosis risk. Rationale. Low-dose aspirin, A, reduces thrombosis risk in polycythemia vera by inhibiting platelet aggregation. It does not increase red blood cells, B, prevent infection, C, or enhance immunity, D. 160. A nurse is caring for a patient with a history of deep vein thrombosis. Which symptom requires immediate attention? A. Leg swelling. B. Mild fatigue. C. Dry skin. D. Increased appetite. Answer. A. Leg swelling. Rationale. Leg swelling, A, in DVT suggests worsening thrombosis or new clot formation, requiring immediate attention. Fatigue, B, dry skin, C, and increased appetite, D, are not urgent or specific to DVT. 161. A patient with iron deficiency anemia is prescribed parenteral iron. What should the nurse monitor during administration? A. Allergic reactions. B. Blood glucose levels. C. Respiratory rate. D. Skin turgor. Answer. A. Allergic reactions. Rationale. Parenteral iron can cause allergic reactions, including anaphylaxis, so monitoring for these, A, is critical. Blood glucose, B, respiratory rate, C, and skin turgor, D, are not primary concerns during administration. 162. A nurse is assessing a patient with suspected disseminated intravascular coagulation, DIC. Which lab result is most concerning? A. D-dimer elevation. B. Normal hemoglobin. C. Normal platelet count. D. Decreased INR. Answer. A. D-dimer elevation. Rationale. Elevated D-dimer, A, indicates fibrin breakdown, a key feature of DIC, and is concerning. Normal hemoglobin, B, and platelet count, C, are inconsistent with DIC. Decreased INR, D, is not typical as INR is usually prolonged. 163. A patient with sickle cell anemia reports fever and joint pain. What is the nurse's priority action? A. Administer antipyretics. B. Assess for infection. C. Apply a heating pad. D. Restrict fluid intake. Answer. B. Assess for infection. Rationale. Fever and joint pain in sickle cell anemia suggest infection, a serious complication, so assessing for infection, B, is the priority. Antipyretics, A, treat symptoms. Heating pads, C, are contraindicated. Fluid restriction, D, is inappropriate. 164. A nurse is teaching a patient with hemophilia about self-care. Which instruction is most important? A. Report unusual bleeding. B. Increase dietary sodium. C. Avoid low-impact exercise. D. Restrict fluid intake. Answer. A. Report unusual bleeding. Rationale. Prompt reporting of unusual bleeding, A, is critical in hemophilia to prevent complications. Sodium intake, B, and fluid restriction, D, are unrelated. Low-impact exercise, C, is safe and encouraged. 165. A patient with multiple myeloma reports fatigue. What should the nurse assess first? A. Hemoglobin level. B. Blood glucose. C. Respiratory rate. D. Skin integrity. Answer. A. Hemoglobin level. Rationale. Fatigue in multiple myeloma is often due to anemia, so assessing hemoglobin level, A, is the first step. Blood glucose, B, respiratory rate, C, and skin integrity, D, are not directly related to fatigue in this context. 166. A nurse is caring for a patient receiving a blood transfusion. Which action prevents complications? A. Infuse slowly over 2 to 4 hours. B. Mix with dextrose solution. C. Administer without a filter. D. Infuse rapidly within 1 hour. Answer. A. Infuse slowly over 2 to 4 hours. Rationale. Infusing blood over 2 to 4 hours, A, prevents fluid overload and transfusion reactions. Dextrose, B, causes hemolysis. A filter, C, is required. Rapid infusion, D, risks complications. 167. A patient with iron deficiency anemia reports shortness of breath. What is the nurse's priority action? A. Administer supplemental oxygen. B. Encourage vigorous exercise. C. Restrict dietary iron. D. Apply a warm compress. Answer. A. Administer supplemental oxygen. Rationale. Shortness of breath in iron deficiency anemia indicates hypoxia, so administering supplemental oxygen, A, is the priority. Vigorous exercise, B, is unsafe. Iron restriction, C, worsens anemia. Warm compresses, D, are irrelevant. 168. A nurse is caring for a patient with a history of pulmonary embolism. Which lab test monitors therapy? A. APTT. B. INR. C. Hemoglobin. D. Platelet count. Answer. B. INR. Rationale. INR, B, monitors warfarin therapy, commonly used for pulmonary embolism. APTT. A. Monitors heparin. Hemoglobin, C, and platelet count, D, are not specific to anticoagulant therapy. 169. A patient with sickle cell disease is prescribed pain medication. What should the nurse monitor? A. Respiratory depression. B. Blood glucose levels. C. Skin turgor. D. Joint mobility. Answer. A. Respiratory depression. Rationale. Pain medications, e.g., opioids, in sickle cell disease can cause respiratory depression, A, a serious side effect requiring monitoring. Blood glucose, B, skin turgor, C, and joint mobility, D, are not primary concerns with pain medication. 170. A nurse is assessing a patient with suspected von Willebrand disease. Which lab test confirms the diagnosis? A, von Willebrand factor assay. B, complete blood count. C, prothrombin time. D, blood glucose. Answer: A, von Willebrand factor assay. Rationale: a von Willebrand factor assay, A, confirms von Willebrand disease by measuring factor levels. Complete blood count, B, is nonspecific. Prothrombin time, C, assesses clotting but not von Willebrand factor. Blood glucose, D, is unrelated. 171. A patient with chronic lymphocytic leukemia reports a sore throat. What is the nurse's priority action? A, administer analgesics. B, assess for infection. C, encourage fluid restriction. D, apply a warm compress. Answer: B, assess for infection. Rationale: a sore throat in chronic lymphocytic leukemia suggests infection due to immunosuppression, so assessing for infection, B, is the priority. Analgesics, A, and warm compresses, D, treat symptoms. Fluid restriction, C, is inappropriate. 172. A nurse is caring for a patient with a platelet count of 15,000/mm superscript 3. Which symptom requires immediate attention? A, petechiae. B, mild fatigue. C, dry skin. D, increased appetite. Answer: A, petechiae. Rationale: petechiae, A, indicate active bleeding in severe thrombocytopenia, 15,000/mm superscript 3, requiring immediate attention. Fatigue, B, dry skin, C, and increased appetite, D, are not urgent or specific. 173. A patient with pernicious anemia is prescribed vitamin B12 injections. What should the nurse teach about administration? A, rotate injection sites. B, take orally with meals. C, discontinue after 1 week. D, avoid vitamin C. Answer: A, rotate injection sites. Rationale: rotating injection sites, A, prevents tissue damage from repeated vitamin B12 injections. Oral administration, B, is ineffective in pernicious anemia. Discontinuing after 1 week, C, is incorrect as therapy is lifelong. Vitamin C, D, does not interfere. 174. A nurse is caring for a patient with a history of blood transfusions. Which medication prevents iron overload? A, deferoxamine. B, epoetin alpha. C, folic acid. D, vitamin B12. Answer: A, deferoxamine. Rationale: deferoxamine, A, is a chelating agent that removes excess iron, preventing iron overload from transfusions. Epoetin alpha, B, stimulates red blood cells. Folic acid, C, and vitamin B12, D, treat anemias but not iron overload. 175. A patient with multiple myeloma reports nausea. What should the nurse assess first? A, serum calcium levels. B, blood glucose. C, respiratory rate. D, skin integrity. Answer: A, serum calcium levels. Rationale: nausea in multiple myeloma may indicate hypercalcemia, A, from bone destruction, a common complication. Blood glucose, B, respiratory rate, C, and skin integrity, D, are not directly related to nausea in this context. 176. A nurse is caring for a patient receiving a blood transfusion. Which lab result indicates a hemolytic reaction? A, elevated bilirubin. B, decreased hemoglobin. C, normal platelet count. D, normal white blood cell count. Answer: A, elevated bilirubin. Rationale: elevated bilirubin, A, indicates red blood cell destruction, a sign of a hemolytic transfusion reaction. Decreased hemoglobin, B, may occur but is less specific. Normal platelet count, C, and white blood cell count, D, are not indicative of hemolysis. 177. A patient with iron deficiency anemia reports fatigue. What is the nurse's best action? A. Encourage rest periods. B. Promote vigorous exercise. C. Restrict dietary iron. D. Apply a warm compress. Answer. A. Encourage rest periods. Rationale. Fatigue and iron deficiency anemia results from reduced oxygen delivery, so encouraging rest periods, A. Conserves energy. Vigorous exercise, B. Is unsafe. Iron restriction, C. Worsens anemia. Warm compresses, D. Are irrelevant. 178. A nurse is caring for a patient with a history of pulmonary embolism. Which activities should the patient avoid? A. Prolonged sitting. B. Low-impact exercise. C. Deep breathing. D. Balanced diet. Answer. A. Prolonged sitting. Rationale. Prolonged sitting, A. Increases venous stasis, raising the risk of recurrent pulmonary embolism. Low-impact exercise, B. Deep breathing, C. And a balanced diet, D. Are safe and beneficial. 179. A patient with sickle cell anemia is prescribed oxygen therapy. What should the nurse monitor? A. Oxygen saturation. B. Blood glucose. C. Skin turgor. D. Joint mobility. Answer. A. Oxygen saturation. Rationale. Oxygen therapy in sickle cell anemia aims to improve oxygenation, so monitoring oxygen saturation, A. Assesses effectiveness. Blood glucose, B. Skin turgor, C. And joint mobility, D. Are not directly related to oxygen therapy. 180. A nurse is assessing a patient with suspected hemophilia. Which family history finding supports the diagnosis? A. Bleeding disorders in males. B. Hypertension in siblings. C. Diabetes in parents. D. Asthma in relatives. Answer. A. Bleeding disorders in males. Rationale. Hemophilia is an X-linked disorder primarily affecting males, so a family history of bleeding disorders in males, A. Supports the diagnosis. Hypertension, B. Diabetes, C. And asthma, D. Are unrelated to hemophilia. 181. A patient with sickle cell anemia reports severe back pain. What is the nurse's priority action? A. Apply a heating pad. B. Administer prescribed analgesics. C. Encourage spinal flexion exercises. D. Restrict fluid intake. Answer. B. Administer prescribed analgesics. Rationale. Severe back pain in sickle cell anemia likely indicates vaso-occlusion, requiring analgesics, B, as the priority for pain management. Heating pads, A, are contraindicated as they may worsen vaso-occlusion. Spinal flexion exercises, C, could exacerbate pain. Fluid restriction, D, is inappropriate as hydration is essential. 182. A nurse is monitoring a patient receiving heparin. Which symptom indicates a potential overdose? A. Hematuria. B. Weight gain. C. Fever. D. Dry skin. Answer. A. Hematuria. Rationale. Hematuria, A, is a sign of bleeding, indicating a potential heparin overdose due to excessive anticoagulation. Weight gain, B, fever, C, and dry skin, D, are not directly related to heparin overdose. 183. A patient with leukemia is prescribed filgrastim. What is the purpose of this medication? A. Increase white blood cell count. B. Reduce bone pain. C. Prevent bleeding. D. Enhance red blood cell production. Answer. A. Increase white blood cell count. Rationale. Filgrastim, A, stimulates neutrophil production, increasing white blood cell count to reduce infection risk in leukemia patients. It does not reduce bone pain, B, prevent bleeding, C, or enhance red blood cells, D. 184. A nurse is caring for a patient receiving a blood transfusion. Which action should be taken if a transfusion reaction is suspected? A. Continue the transfusion. B. Stop the transfusion immediately. C. Increase the infusion rate. D. Administer a diuretic. Answer. B. Stop the transfusion immediately. Rationale. Stopping the transfusion immediately, B, is critical if a reaction is suspected to prevent further complications. Continuing, A. Or increasing the rate, C. Worsens the reaction. Diuretics, D. Are not indicated for transfusion reactions. 185. A patient with iron deficiency anemia reports dark stools. What should the nurse explain? A. This is a normal side effect of iron supplements. B. This indicates gastrointestinal bleeding. C. This is a sign of infection. D. This requires immediate discontinuation of iron. Answer. A. This is a normal side effect of iron supplements. Rationale. Dark stools, A. Are a common, benign side effect of iron supplements due to unabsorbed iron. Gastrointestinal bleeding, B. Would require further assessment. Infection, C. Is unrelated. Discontinuation, D. Is unnecessary without other symptoms. 186. A patient with hemophilia A reports a nosebleed. What is the nurse's first action? A. Apply ice to the nose. B. Administer factor VIII. C. Encourage vigorous nose blowing. D. Restrict fluid intake. Answer. B. Administer factor VIII. Rationale. A nosebleed in hemophilia A requires factor VIII, B. To correct the clotting deficiency and stop bleeding. Ice, A. Is helpful but secondary. Vigorous nose blowing, C. Worsens bleeding. Fluid restriction, D. Is irrelevant. 187. A nurse is caring for a patient with a platelet count of 10,000/mm superscript 3. Which intervention is most important? A. Implement bleeding precautions. B. Encourage contact sports. C. Apply warm compresses to bruises. D. Allow vigorous oral hygiene. Answer. A. Implement bleeding precautions. Rationale. A platelet count of 10,000/mm superscript 3 indicates severe thrombocytopenia, requiring bleeding precautions, A. E.g., soft toothbrush, electric razor, to prevent hemorrhage. Contact sports, B. And vigorous oral hygiene, D. Increase bleeding risk. Warm compresses, C. Worsen bruising. 188. A patient with pernicious anemia reports chest pain. What should the nurse assess first? A. Oxygen saturation. B. Blood glucose. C. Skin turgor. D. Joint mobility. Answer. A. Oxygen saturation. Rationale. Chest pain in pernicious anemia may indicate hypoxia due to severe anemia, so assessing oxygen saturation, A. Is the priority. Blood glucose, B. Skin turgor, C. And joint mobility, D. Are not directly related to chest pain in this context. 189. A nurse is teaching a patient with sickle cell disease about infection prevention. Which instruction is most important? A. Maintain up-to-date vaccinations. B. Avoid low-impact exercise. C. Restrict dietary protein. D. Use heating pads for pain. Answer. A. Maintain up-to-date vaccinations. Rationale. Vaccinations. A. Prevent infections, a major risk in sickle cell disease due to splenic dysfunction. Low-impact exercise, B. Is safe. Protein restriction, C. Is unnecessary. Heating pads, D. Are contraindicated. 190. A patient with multiple myeloma is prescribed zoledronic acid. What should the nurse monitor? A. Serum calcium levels. B. Blood glucose. C. Respiratory rate. D. Skin integrity. Answer. A. Serum calcium levels. Rationale. Zoledronic acid treats hypercalcemia in multiple myeloma, so monitoring serum calcium levels, A. Assesses effectiveness. Blood glucose, B. Respiratory rate, C. And skin integrity, D. Are not primary concerns with this medication. 191. A nurse is caring for a patient with a history of deep vein thrombosis, DVT. Which instruction promotes prevention? A. Elevate legs when sitting. B. Restrict fluid intake. C. Apply warm compresses to legs. D. Encourage prolonged bed rest. Answer. A. Elevate legs when sitting. Rationale. Elevating legs, A. Promotes venous return, reducing DVT risk. Fluid restriction, B. Is inappropriate. Warm compresses, C. May increase swelling. Prolonged bed rest, D, increases stasis and clot risk. 192. A patient with thalassemia major reports joint pain. What should the nurse suspect? A. Iron overload. B. Osteoarthritis. C. Infection. D. Vaso-occlusion. Answer: A. Iron overload. Rationale: joint pain in thalassemia major is often due to iron overload, A. From frequent transfusions, causing tissue damage. Osteoarthritis, B, and infection, C, are less likely. Vaso-occlusion, D, is specific to sickle cell disease. 193. A nurse is assessing a patient with suspected disseminated intravascular coagulation, DIC. Which physical finding is most concerning? A. Prolonged bleeding from 4 sites. B. Blood pressure 130/85 mmHg. C. Heart rate 80 bpm. D. Respiratory rate 16 breaths/min. Answer: A. Prolonged bleeding from 4 sites. Rationale: prolonged bleeding from 4 sites, A, indicates active bleeding in DIC, a critical finding requiring intervention. Blood pressure, B, heart rate, C, and respiratory rate, D, are normal and not specific to DIC. 194. A patient with chronic lymphocytic leukemia is prescribed fludarabine. What is the nurse's priority teaching? A. Monitor for signs of infection. B. Maintain a low-calcium diet. C. Avoid deep breathing exercises. D. Increase sun exposure. Answer: A. Monitor for signs of infection. Rationale: fludarabine causes immunosuppression, increasing infection risk, so monitoring for infection signs, A, is critical. Low-calcium diet, B, is not indicated. Deep breathing, C, prevents complications. Sun exposure, D, increases skin damage risk. 195. A nurse is preparing a patient for a bone marrow biopsy. Which instruction ensures safety? A. Obtain informed consent. B. Encourage vigorous activity pre-procedure. C. Restrict fluid intake. D. Apply a warm compress to the site. Answer: A. Obtain informed consent. Rationale: informed consent, A, is required for a bone marrow biopsy to ensure the patient understands risks and benefits. Vigorous activity, B, is inappropriate. Fluid restriction, C, is unnecessary. Warm compresses, D, are not indicated. 196. A patient with iron deficiency anemia reports tachycardia. What is the nurse's first action? A. Assess oxygen saturation. B. Encourage vigorous exercise. C. Restrict dietary iron. D. Apply a warm compress. Answer: A. Assess oxygen saturation. Rationale: tachycardia in iron deficiency anemia may indicate hypoxia, so assessing oxygen saturation, A, is the priority. Vigorous exercise, B, is unsafe. Iron restriction, C, worsens anemia. Warm compresses, D, are irrelevant. 197. A nurse is caring for a patient with a history of heparin therapy. Which lab result indicates a risk of bleeding? A. APTT of 90 seconds. B. INR of 1.0. C. Hemoglobin of 12G/DL. D. Platelet count of 200,000/mm superscript 3. Answer: A. APTT of 90 seconds. Rationale: an APTT of 90 seconds, A, is excessively prolonged, indicating a high bleeding risk with heparin. INR, B, monitors warfarin. Hemoglobin, C, and platelet count, D, are normal and not specific to heparin overdose. 198. A patient with sickle cell disease reports vision changes. What should the nurse suspect? A. Retinal vaso-occlusion. B. Cataracts. C. Glaucoma. D. Conjunctivitis. Answer: A. Retinal vaso-occlusion. Rationale: vision changes in sickle cell disease are likely due to retinal vaso-occlusion, A, a complication from sickle-shaped cells obstructing blood flow. Cataracts, B, glaucoma, C, and conjunctivitis, D, are less likely without specific risk factors. 199. A nurse is teaching a patient with hemophilia about medication safety. Which medication is safe for pain relief? A. Acetaminophen. B. Ibuprofen. C. Aspirin. D. Naproxen. Answer: A. Acetaminophen. Rationale: acetaminophen, A, is safe for pain relief in hemophilia as it does not affect bleeding. Ibuprofen, B, aspirin, C, and naproxen, D, inhibit platelet function, increasing bleeding risk. 200. A patient with multiple myeloma reports weakness. What should the nurse assess first? A. Serum calcium levels. B. Blood glucose. C. Respiratory rate. D. Skin integrity. Answer: A. Serum calcium levels. Rationale: weakness in multiple myeloma may indicate hypercalcemia, A, from bone destruction, a common complication. Blood glucose, B, respiratory rate, C, and skin integrity, D, are not directly related to weakness in this context. 201. A nurse is caring for a patient receiving a platelet transfusion. Which vital sign change indicates a reaction? A. Temperature increased to 101 degrees Fahrenheit. B. Heart rate of 70 bpm. C. Blood pressure of 120 over 80 mmHg. D. Respiratory rate of 16 breaths/min. Answer: A. Temperature increased to 101 degrees Fahrenheit. Rationale: a temperature increased to 101 degrees Fahrenheit, A, suggests a febrile non-hemolytic reaction during a platelet transfusion, requiring intervention. Heart rate, B, blood pressure, C, and respiratory rate, D, are normal and not indicative of a reaction. 202. A patient with iron deficiency anemia is prescribed ferrous sulfate. What should the nurse teach about storage? A. Store in a cool, dry place. B. Keep in a refrigerator. C. Store with food. D. Keep in a humid environment. Answer: A. Store in a cool, dry place. Rationale: ferrous sulfate should be stored in a cool, dry place, A, to maintain stability. Refrigeration, B, is unnecessary. Storing with food, C, risks contamination. Humidity, D, may degrade the medication. 203. A nurse is caring for a patient with a history of pulmonary embolism. Which diagnostic test monitors treatment? A. D-dimer. B. INR. C. Hemoglobin. D. Platelet count. Answer: B. INR. Rationale: INR, B, monitors warfarin therapy, commonly used for pulmonary embolism. D-dimer, A, diagnoses clots but not treatment. Hemoglobin, C, and platelet count, D, are not specific to anticoagulant therapy. 204. A patient with sickle cell anemia reports abdominal distension. What is the nurse's first action? A. Assess bowel sounds. B. Encourage ambulation. C. Apply a warm compress. D. Restrict fluid intake. Answer: A. Assess bowel sounds. Rationale: abdominal distension in sickle cell anemia may indicate vaso-occlusion or organ complications, so assessing bowel sounds, A, evaluates gastrointestinal function. Ambulation, B, may be unsafe. Warm compresses, C, are ineffective. Fluid restriction, D, is inappropriate. 205. A nurse is teaching a patient with folate deficiency anemia. Which dietary change is most effective? A. Increase leafy green vegetables. B. Increase dairy products. C. Increase refined grains. D. Increase bananas. Answer: A. Increase leafy green vegetables. Rationale: leafy green vegetables, A, are high in folate, essential for folate deficiency anemia. Dairy, B, refined grains, C, and bananas, D, are low in folate and less effective. 206. A patient with chronic lymphocytic leukemia reports night sweats. What should the nurse document these as? A. B symptoms. B. Allergic reactions. C. Infection signs. D. Metabolic imbalances. Answer: A. B symptoms. Rationale: night sweats in chronic lymphocytic leukemia are B symptoms, A, indicating systemic disease. They are not allergic reactions, B, infection signs, C, or metabolic imbalances, D. 207. A nurse is caring for a patient with a platelet count of 20, 000/mm superscript 3. Which activity should the patient avoid? A. Using a soft toothbrush. B. Shaving with a straight razor. C. Eating a balanced diet. D. Assisted ambulation. Answer: B. Shaving with a straight razor. Rationale: a platelet count of 20,000/mm superscript 3 indicates severe thrombocytopenia, so shaving with a straight razor. B. Risks bleeding. A soft toothbrush, A. Balanced diet, C. And assisted ambulation, D. Are safe. 208. A patient with pernicious anemia reports paresthesia. What is the nurse's best action? A. Administer vitamin B12. B. Encourage ambulation. C. Apply warm compresses. D. Restrict dietary folate. Answer: A. Administer vitamin B12. Rationale: paresthesia in pernicious anemia is due to vitamin B12 deficiency affecting nerves, so administering vitamin B12, A, is the best action. Ambulation, B, does not treat neuropathy. Warm compresses, C, are ineffective. Folate restriction, D, is unnecessary. 209. A nurse is monitoring a patient receiving warfarin. Which interaction should the nurse teach the patient to avoid? A. Grapefruit juice. B. Orange juice. C. Milk. D. Bananas. Answer: A. Grapefruit juice. Rationale: grapefruit juice, A, can interfere with warfarin metabolism, affecting INR levels. Orange juice, B, milk, C, and bananas, D, do not significantly interact with warfarin. 210. A patient with sickle cell disease is admitted with a fever. What is the nurse's first action? A. Administer antipyretics. B. Obtain blood cultures. C. Restrict oral fluids. D. Apply a cooling blanket. Answer: B. Obtain blood cultures. Rationale: fever in sickle cell disease suggests infection, so obtaining blood cultures, B, identifies the cause and guides treatment. Antipyretics, A, and cooling blankets, D, treat symptoms. Fluid restriction, C, is inappropriate. 211. A nurse is caring for a patient with a history of hemophilia. Which lab result indicates effective treatment? A. Normal factor VIII levels. B. Increased platelet count. C. Normal hemoglobin. D. Decreased INR. Answer: A. Normal factor VIII levels. Rationale: hemophilia A treatment aims to normalize factor VIII levels, A. Platelet count, B, hemoglobin, C, and INR, D, are not specific to hemophilia treatment. 212. A patient with multiple myeloma is at risk for which condition? A. Hypercalcemia. B. Hypoglycemia. C. Hyponatremia. D. Hypokalemia. Answer: A. Hypercalcemia. Rationale: multiple myeloma causes bone destruction, leading to hypercalcemia, A. Hypoglycemia, B. Hyponatremia, C. And hypokalemia, D, are not primary complications. 213. A nurse is caring for a patient receiving a blood transfusion. Which symptom indicates an allergic reaction? A. Itching. B. Fever. C. Dyspnea. D. Chills. Answer: A. Itching. Rationale: itching, A, is a sign of an allergic transfusion reaction, often with hives. Fever, B, and chills, D, suggest a febrile reaction. Dyspnea, C, may indicate fluid overload or hemolysis. 214. A patient with iron deficiency anemia reports leg cramps. What should the nurse assess first? A. Electrolyte levels. B. Blood glucose. C. Skin turgor. D. Joint mobility. Answer: A. Electrolyte levels. Rationale: leg cramps and iron deficiency anemia may indicate electrolyte imbalances, A, from dietary deficiencies or treatment side effects. Blood glucose, B, skin turgor, C, and joint mobility, D, are not directly related to leg cramps. 215. A nurse is caring for a patient with a history of pulmonary embolism. Which instruction promotes safety? A. Wear compression stockings. B. Restrict physical activity. C. Increase dietary sodium.
D. Apply heat to the chest.
Answer: A. Wear compression stockings. Rationale: compression stockings A. Promote venous return, reducing clot risk in pulmonary embolism. Restricting activity B. Is unnecessary long-term. Sodium intake C. Is unrelated. Heat D. Is not indicated. 216. A patient with sickle cell anemia reports chest tightness. What is the nurse's first action? A. Assess lung sounds. B. Encourage ambulation. C. Apply a warm compress. D. Restrict fluid intake. Answer: A. Assess lung sounds. Rationale: chest tightness in sickle cell anemia may indicate acute chest syndrome, so assessing lung sounds A. is the priority. Ambulation B. may worsen symptoms. Warm compresses C. are ineffective. Fluid restriction D. is inappropriate. 217. A nurse is teaching a patient with hemophilia about activity safety. Which activity is safe? A. Swimming.
B. Football.
C. Weightlifting. D. Boxing. Answer: A. Swimming. Rationale: swimming A. is a low-impact activity safe for hemophilia patients. Football B. Weightlifting C. and boxing D. are high risk for trauma and bleeding. 218. A patient with chronic lymphocytic leukemia reports bruising. What is the nurse's first action? A. Assess platelet count. B. Encourage ambulation. C. Apply a warm compress. D. Restrict fluid intake. Answer: A. Assess platelet count. Rationale: bruising in chronic lymphocytic leukemia may indicate thrombocytopenia, so assessing platelet count A. is the priority. Ambulation B. risks injury. Warm compresses C. worsen bruising. Fluid restriction D. is irrelevant. 219. A nurse is caring for a patient with a platelet count of 30,000/mm superscript 3. Which medication should be avoided? A. Aspirin. B. Acetaminophen. C. Vitamin C. D. Calcium supplements. Answer: A. Aspirin. Rationale: aspirin A. inhibits platelet function, increasing bleeding risk in thrombocytopenia. Acetaminophen B. Vitamin C, and calcium D. do not affect bleeding risk. 220. A patient with pernicious anemia reports difficulty swallowing. What should the nurse suspect? A. Glossitis. B. Esophageal stricture. C. Gastritis. D. Dehydration. Answer: A. Glossitis. Rationale: difficulty swallowing in pernicious anemia is often due to glossitis. A. Inflammation of the tongue from vitamin B12 deficiency. Esophageal stricture B. Gastritis C. and dehydration D. are less likely without specific symptoms. 221. A nurse is monitoring a patient receiving fresh frozen plasma. Which lab result indicates effective treatment? A. Normal prothrombin time. B. Increased hemoglobin. C. Normal platelet count. D. Decreased white blood cell count. Answer: A. Normal prothrombin time. Rationale: fresh frozen plasma corrects coagulopathy, so a normal prothrombin time A. indicates effective treatment. Hemoglobin B, platelet count C, and white blood cell count D are not directly affected by plasma. 222. A patient with polycythemia vera reports itching after bathing. What should the nurse suspect? A. Aquagenic pruritus. B. Allergic reaction. C. Infection. D. Dehydration. Answer: A. Aquagenic pruritus. Rationale: itching after bathing in polycythemia vera is aquagenic pruritus. A common symptom due to histamine release. Allergic reaction B. Infection C. and dehydration D. are less likely without specific symptoms. 223. A nurse is caring for a patient with a history of deep vein thrombosis. Which lab test monitors for recurrence? A. D-dimer.
B. Hemoglobin.
C. Platelet count. D. Blood glucose. Answer: A. D-dimer. Rationale: elevated D-dimer A. indicates clot formation, useful for detecting DVT recurrence. Hemoglobin B, platelet count C, and blood glucose D are not specific to DVT recurrence. 224. A patient with iron deficiency anemia reports hair loss. What should the nurse explain? A. This is a common symptom of anemia. B. This indicates an allergic reaction. C. This is a sign of infection. D. This requires immediate discontinuation of iron. Answer. A. This is a common symptom of anemia. Rationale. Hair loss, A, can occur in iron deficiency anemia due to reduced oxygen delivery to hair follicles. Allergic reaction, B, and infection, C, are unrelated. Discontinuation, D, is unnecessary without other symptoms. 225. A nurse is caring for a patient with a history of pulmonary embolism. Which symptom indicates a recurrence? A. Dyspnea. B. Mild fatigue. C. Dry skin. D. Increased appetite. Answer. A. Dyspnea. Rationale. Dyspnea, A, is a hallmark of pulmonary embolism recurrence, indicating compromised lung perfusion. Fatigue, B, dry skin, C, and increased appetite, D, are not specific to recurrence. 226. A patient with sickle cell anemia is prescribed folic acid. What is the purpose of this supplement? A. Enhance red blood cell production. B. Reduce pain. C. Prevent infection. D. Increase platelet production. Answer. A. Enhance red blood cell production. Rationale. Folic acid, A, supports red blood cell production in sickle cell anemia, where rapid cell turnover occurs. It does not reduce pain, B, prevent infection, C, or increase platelets, D. 227. A nurse is teaching a patient with hemophilia about self-care. Which instruction is most important? A. Wear a medical alert bracelet. B. Increase dietary sodium. C. Avoid low-impact exercise. D. Restrict fluid intake. Answer. A. Wear a medical alert bracelet. Rationale. A medical alert bracelet, A, ensures prompt treatment for bleeding in hemophilia during emergencies. Sodium intake, B, and fluid restriction, D, are unrelated. Low-impacted exercise, C, is safe. 228. A patient with chronic lymphocytic leukemia reports weight loss. What should the nurse assess next? A. Presence of fever. B. Blood glucose levels. C. Joint range of motion. D. Skin hydration. Answer. A. Presence of fever. Rationale. Weight loss in chronic lymphocytic leukemia may be a B symptom, often accompanied by fever, A, indicating disease progression. Blood glucose, B, joint range, C, and skin hydration, D, are not directly related. 229. A nurse is caring for a patient with a platelet count of 15,000/mm superscript 3. Which symptom indicates a medical emergency? A. Intracranial bleeding. B. Mild fatigue. C. Dry skin. D. Increased appetite. Answer. A. Intracranial bleeding. Rationale. Intracranial bleeding, A, in severe thrombocytopenia, 15,000/mm superscript 3, is a medical emergency requiring immediate intervention. Fatigue, B, dry skin, C, and increased appetite, D, are not urgent. 230. A patient with pernicious anemia is prescribed vitamin B12. What should the nurse monitor? A. Neurological symptoms. B. Blood glucose. C. Respiratory rate. D. Skin turgor. Answer. A. Neurological symptoms. Rationale. Vitamin B12 deficiency in pernicious anemia can cause neurological symptoms, e.g., paresthesia. So monitoring these, A, assesses treatment response. Blood glucose, B, respiratory rate, C, and skin turgor, D, are not primary concerns. 231. A nurse is monitoring a patient receiving warfarin. Which lab result indicates a need for intervention? A. INR of 4.0. B. INR of 2.5. C. Platelet count of 200,000/mm superscript 3. D. Hemoglobin of 12G/DL. Answer. A. INR of 4.0. Rationale. An INR of 4.0, A, is above the therapeutic range, 2.0 to 3.0, indicating a bleeding risk requiring intervention. INR of 2.5, B, is therapeutic. Platelet count, C, and hemoglobin D are normal. 232. A patient with sickle cell disease reports leg swelling. What is the nurse's first action? A. Elevate the leg. B. Apply a warm compress. C. Encourage ambulation. D. Restrict fluid intake. Answer. A. Elevate the leg. Rationale. Leg swelling in sickle cell disease may indicate vaso-occlusion or thrombosis, so elevating the leg, A, reduces swelling. Warm compresses, B, may worsen swelling. Ambulation, C, risks complications. Fluid restriction, D, is inappropriate. 233. A nurse is teaching a patient with folate deficiency anemia. Which food is most beneficial? A. Fortified cereals. B. White rice. C. Milk. D. Apples. Answer. A. Fortified cereals. Rationale. Fortified cereals, A, are high in folate, beneficial for folate deficiency anemia. White rice, B, milk, C, and apples, D, are low in folate. 234. A patient with multiple myeloma reports bone pain. What is the nurse's best action? A. Administer prescribed analgesics. B. Encourage weight-bearing exercises. C. Apply ice to affected areas. D. Restrict calcium supplements. Answer. A. Administer prescribed analgesics. Rationale. Bone pain in multiple myeloma is due to lytic lesions, requiring analgesics, A, for relief. Weight-bearing exercises, B, may increase fracture risk. Ice, C, is less effective. Calcium supplements, D, may be needed for hypercalcemia. 235. A nurse is caring for a patient receiving a blood transfusion. Which lab result indicates a transfusion reaction? A. Elevated lactate dehydrogenase. B. Normal hemoglobin. C. Normal platelet count. D. Decreased white blood cell count. Answer. A. Elevated lactate dehydrogenase. Rationale. Elevated lactate dehydrogenase, A, indicates hemolysis, a sign of a transfusion reaction. Normal hemoglobin, B, platelet count, C, and decreased white blood cell count, D, are not specific to transfusion reactions. 236. A patient with iron deficiency anemia reports brittle nails. What should the nurse explain? A. This is a common symptom of anemia. B. This indicates an allergic reaction. C. This is a sign of infection. D. This requires immediate discontinuation of iron. Answer. A. This is a common symptom of anemia. Rationale. Brittle nails, A, are a common symptom of iron deficiency anemia due to reduced oxygen delivery. Allergic reaction, B, and infection, C, are unrelated. Discontinuation, D, is unnecessary. 237. A nurse is caring for a patient with a history of pulmonary embolism. Which medication is most likely prescribed long-term? A. Warfarin. B. Aspirin. C. Clopidogrel. D. Iron supplements. Answer. A. Warfarin. Rationale. Warfarin, A, is commonly prescribed long-term for pulmonary embolism to prevent recurrence. Aspirin, B, and clopidogrel, C, are antiplatelet agents, not primary for embolism. Iron supplements, D, are unrelated. 238. A patient with sickle cell anemia reports fatigue. What is the nurse's first action? A. Assess hemoglobin level. B. Encourage vigorous exercise. C. Restrict fluid intake. D. Apply a warm compress. Answer. A. Assess hemoglobin level. Rationale. Fatigue in sickle cell anemia is likely due to anemia, so assessing hemoglobin level, A, is the first step. Vigorous exercise, B, is unsafe. Fluid restriction, C, is inappropriate. Warm compresses, D, are irrelevant. 239. A nurse is teaching a patient with hemophilia about bleeding management. Which instruction is most important? A. Apply firm pressure to bleeding sites. B. Increase dietary sodium. C. Avoid low-impact exercise. D. Restrict fluid intake. Answer: A. Apply firm pressure to bleeding sites. Rationale: applying firm pressure, A. controls bleeding in hemophilia, a critical self-care measure. Sodium intake, B, and fluid restriction, D, are unrelated. Low-impact exercise, C, is safe. 240. A patient with chronic lymphocytic leukemia is prescribed rituximab. What should the nurse monitor during infusion? A. Infusion-related reactions. B. Blood glucose. C. Respiratory rate. D. Skin turgor. Answer: A. Infusion-related reactions. Rationale: rituximab can cause infusion-related reactions, e.g., fever, chills, so monitoring these, A, is critical. Blood glucose, B, respiratory rate, C, and skin turgor, D, are not primary concerns.